The Subcommittee on Oversight and Investigations hearing will now come to order. Today, the committee is holding a hearing entitled Sounding the Alarm, the Public Health Threats of E-Cigarettes. The purpose of today's hearing is to examine the public health impacts and regulatory authorities related to e-cigarette manufacturing, sales, and use. The chair now recognizes herself for purposes of an opening statement. Our country is facing a serious public health epidemic, one that is causing severe harm. This hearing will examine the cause of that epidemic, the uncontrolled and rising use of e-cigarettes. As life-threatening illnesses sweep the country and the use of e-cigarette products by young people soars, we must act to protect the American people from the myths and the misunderstanding about these products. First, the data is now clear. Over the past several years, we've seen an unacceptably high proportion of young people facing nicotine addiction. This year alone, more than 27% of high schoolers report they are using e-cigarettes or vaping, as it's also known. From 2011 to 2015, there was a 900% increase, in youth vaping. And from 2017 to today, the rate of high school use doubled. The vaping epidemic and its impact are personal to me. My home state of Colorado has the unfortunate distinction of leading the country in teen vaping. A major factor contributing to the continued dramatic rise of e-cigarette use among teens is the inundation of flavored products. Recent data from the Centers for Disease Control and Prevention indicate that 60% of students using e-cigarettes within the last month cited using popular fruit, menthol, or mint flavors. Young people turning to e-cigarettes also may have the false assumption that these products are safe or relatively harmless. But contrary to many manufacturers' claims, e-cigarettes pose risks to young people and can lead to addiction, harm brain development, affect respiratory health, and can lead to heart disease. Additionally, e-cigarette use increases the risk of youth turning to conventional cigarettes. Now, as much as we do know, the more troubling concern may be how much we don't know about these products. For example, in some cases, we don't even know what chemicals and toxins are being inhaled when vaping. In a very real sense, the e-cigarette industry has launched a massive public health experiment on our country, of which its outcomes and consequences remain unknown. A recent spate of serious vaping illnesses epitomizes just how much we are in the dark about these products. These illnesses, numbering 530 so far and increasing daily, have led to hospitalizations, potential long-term health complications, and several deaths. While CDC and FDA are here today, and I want to thank both witnesses, and they'll provide more information about the status of the investigation and what products may be the culprit, no specific causes of the illnesses have yet been determined. With these agencies engaged and in collaboration with state partners, I have confidence that the root cause of this outbreak eventually will be identified. But even if the cause is isolated to a product sold on the streets or the use of THC, we must keep in mind that branded e-cigarettes sold in stores are not harmless. This brings me to my next concern. Given the potential risks associated with these products, it would be reasonable to assume that the e-cigarettes have been closely reviewed and approved by the FDA, but they haven't. E-cigarette products are only on the market today because FDA is temporarily giving them a pass by exercising its enforcement discretion. Let me be clear. No e-cigarette currently on the market in the United States today has been fully reviewed by FDA for its impact on public health. FDA needs to do its job, examine these products, tell the public what the risks are, and how or even if they can legally be sold. In other words, FDA must go forward with conducting its repeatedly delayed pre-market reviews for all e-cigarette products and determine whether the sale of the product is, quote, appropriate for the protection of public health. Now, after years of the delays around the regulation of e-cigarettes, the administration recently announced that the FDA would prioritize enforcement and clear the shelves of non-tobacco flavored e-cigarette products pending review. I am encouraged by this recent action, but FDA needs to provide additional details and a timeline for action. We have to ensure that this policy will be implemented and enforced in a reasonable way. In the meantime, nothing is stopping manufacturers from submitting their applications to FDA today. The burden is on the cigarette companies to demonstrate that these products meet the FDA's health standard. And regardless of the administration's recent announcement, legislative action is not off the table. I and others have introduced bills to tackle this public health priority, including Chairman Pallone, who's been a steadfast leader on these issues. States on the front lines of the youth epidemic have also been taking action on e-cigarettes. We're going to hear some of their plans today. Now, the industry has been swift to rail against efforts to restrict the products, claiming they assist adult smokers in quitting traditional cigarettes. That evidence, however, is far from conclusive, and FDA has not approved e-cigarettes for cessation purposes. Any benefit to adult smokers has to be weighed against the generation of young people for which vaping represents an on-ramp to use. I want to thank the witnesses for being here today, for their service, and I look forward to hearing how we can work together to address this very serious public health issue, and I will yield to Mr. Guthrie from Kentucky.
Thank you, Chair DeGette, for holding this hearing. And before I get started in my opening statement, I want to say I know a lot of our members are going to have to be going back and forth. For whatever reason, this committee scheduled two important subcommittee hearings at the same time. And so we have drug pricing upstairs. I think everybody agrees it's an important issue for the country, and this important issue for the country as well. And a lot of members share membership of that subcommittee. So I apologize that we're going to be in and out, but that's where we are. And I want to say that I'm deeply concerned about the outgoing break of lung illness associated with vaping and e-cigarette use, as well as the marketing of e-cigarettes to kids. We need to understand the causes of this vaping illness and ensure e-cigarettes are not marketed to kids. It is also important that we understand the health implications of vaping and e-cigarette use more broadly, whether an adult is vaping THC derived from marijuana, nicotine, or another substance. So far, the available evidence of the 553 reported cases of lung illness and 8 deaths do not point to a conclusive cause. But the test samples overwhelmingly suggest involvement of illicit e-cigarette devices, the psychoactive ingredient in marijuana called THC, and other black market products. For example, according to the Centers for Disease Control, most patients have experienced these lung illnesses have reported a history of using e-cigarettes products containing marijuana or THC. However, some have reported using products that contain THC, marijuana with nicotine, while others have reported only using products with nicotine. Separate from the outbreak of lung illnesses, according to the U.S. Food and Drug Administration, the United States has a youth e-cigarette epidemic. The most recent data from the National Youth Tobacco Survey show that 27.5% of youths reported using e-cigarettes, compared with 20.8% in 2018. The rate was only 11.3% just 3 years ago. These trends are unacceptable. The marketing of e-cigarette products to children must be stopped, and youth access to e-cigarette products must be blocked more effectively. This epidemic is already driving legislation and regulatory responses. Last September, the FDA issued more than 1,300 warning letters and fines to brick-and-mortar retailers who illegally sold e-cigarette products to minors, and 5 warning letters to e-cigarette manufacturers about their plans to address youth access of their products. 18 states have increased the legal age to purchase tobacco products to 21. Michigan, New York, and the District of Columbia have issued proposed regulations to ban flavored e-cigarettes. On September 11, 2019, the Trump administration announced that the FDA would finalize a compliance policy to prioritize enforcement against the marketing of unauthorized, non-tobacco flavored e-cigarettes, including mint and menthol e-cigarettes. While these responses are aimed at reducing the attraction of e-cigarettes to youth, wide bans will almost certainly create black markets. In that vein, we will also need a response to an increased black market demand for flavored pods and to address the growing trade in illicit cannabis, marijuana vaping products. A New York Times article reported that a recent bust of THC oil operation in Wisconsin revealed a very advanced and mature illicit market for marijuana vapes cartridges and distribution of contaminated marijuana based vape carts. I am told these illicit operations are using a tactic in other illegal drug operations. They're cutting their product with other substances, including some that could be dangerous. Public health advocates, for example, said a particular cutting agent, vitamin E acetate, is an oil that could cause breathing problems and lung inflammation if not heated fully during the vaping process. By using smaller amounts of the expensive THC or marijuana and diluting it with oils that cost much less, one can increase their profit by selling the product. For example, medium-grade THC can cost $4,000 a kilogram, but additives may cost pennies on the dollar. These operations rely on pen factories that buy empty vape cartridges and counterfeit packaging from Chinese factories, then fill them with THC liquid that they purchase from the United States market. Empty cartridges and packaging are also available to purchase on the internet. While federal and state authorities are working on an effective response against teen e-cigarette use, we must ensure that our youth is educated on the dangers of using e-cigarettes. For example, in Massachusetts, Governor Baker's administration launched a campaign to combat teen vaping and e-cigarette use in April 2019. And the Massachusetts Department of Public Health launched a campaign to highlight the dangers of vape pens and e-cigarettes in July 2018. These actions are commendable, and I look forward to seeing the results of these campaigns. With regard to adults trying to quit smoking, some studies suggest e-cigarettes are less harmful than traditional cigarettes. According to the CDC, e-cigarettes have the potential benefit cessation from combustible cigarettes for adult smokers, but the CDC cautions that e-cigarettes are not safe for youth, young adults, pregnant women, or adults who are not currently using tobacco products. Additional research should go to look at the effectiveness. I want to thank our witnesses for being here on both panels today, and I look forward to this important discussion. Sorry we'll be back and forth between hearings, but that's where we are, and I yield back.
Thank the gentleman. The chair now recognizes the chairman of the full committee, Mr. Plum, for 5 minutes for purposes of an opening statement.
Thank you. I want to thank Chairwoman Gadet for having this very important hearing today. We're examining the growing public health crisis involving e-cigarettes and the proliferation of these products amongst kids and teens, and I'm deeply concerned about the recent outbreak of lung illnesses that have killed 8 people and sickened more than 530 here in the U.S. I'm also very frustrated by the fact that e-cigarette usage has reached epidemic proportions in recent years among kids. If you talk to any parent of a high school student, you know that our nation's e-cigarette problem is real and it's getting worse, and it's long past time for public health agencies to address vaping and e-cigarette usage in a meaningful way. I look forward to hearing about what the FDA and the CDC can tell us about how they're addressing these tragic mystery illnesses and the recent actions to combat youth e-cigarette use. But make no mistake, I firmly believe that many aspects of the youth vaping epidemic could have been addressed if the FDA had moved forward with reviewing all e-cigarettes on the market when it first had the chance 2 years ago. Instead, in July 2017, FDA announced that it would delay implementation of key provisions of the agency's final deeming rule, which ensured the agency would review all e-cigarette products on the market. That same day, I issued a statement expressing deep concerns that these delays would mean that e-cigarette products would continue to lack needed public health oversight for several years and risk continued exposure to a new generation. And here we are over 2 years later, and unfortunately, my concerns have come to fruition. Since that decision, youth e-cigarette usage has skyrocketed. More than 1 in 4 high school students say they've used e-cigarettes in the past 30 days. These products have been marketed and targeted to kids without our knowledge of the full public health consequences, and as a result, we could lose an entire new generation to a lifetime of nicotine addiction. At the same time, hundreds of people throughout the country have developed unknown lung illnesses following the usage of vape products. In many instances, these products were manipulated beyond the product's intended use, but it still remains unclear what these products contained and how exactly they were manipulated. The lack of certainty on the root cause of these illnesses speaks to a larger problem. We do not know the full spectrum of health consequences associated with the use of e-cigarettes. 10 years ago, the Family Smoking Prevention and Tobacco Control Act was signed into law after coming out of this committee. This law gave FDA the tools that it needed to effectively regulate all tobacco products, but unfortunately, that is not happening. Therefore, it's critical that FDA and CDC explain today what actions they're taking and what more we can be doing to protect consumers. And I also look forward to hearing from states that have forged their own responses in the wake of inaction at the federal level. The wide availability of flavored e-cigarette products, clearly designed for kids' consumption, are putting the interests of industry above the health of our kids. While I'm pleased by the administration's announcement that it plans to pull all flavored e-cigarette products from the market until they undergo full FDA review, I believe that ban should occur immediately. Above all else, we must get to the bottom of what is causing these lung illnesses, and we must ensure that vape products are kept out of the hands of our kids. At the same time, it's become clear to me that we must enact new, comprehensive legislation to fully address this growing youth epidemic. We must eliminate flavors, prohibit online sales that make it easy for kids to buy e-cigarettes, and ensure that these products are not being marketed to anyone underage. My legislation, the Reversing Youth Tobacco Epidemic Act, does each of these things while also raising the age to 21 to buy tobacco products. It's my intention to move this critical legislation forward, and I hope that it will receive the strong bipartisan support that it deserves. It's long past time to address the public health risks associated with e-cigarette use. We have to use every tool at our disposal to solve this crisis. And if I could just say, Madam Chair, although it's true, as you mentioned, that we do want to move legislation, I also think that it's very important for the Oversight and Investigation Subcommittee to find out what's happening, what the agencies are doing, what's actually causing this epidemic. So I really appreciate the fact that you're having this hearing. I think we need to have this hearing. As much as I want to move forward with the legislation, we need to have this hearing first to get to the bottom of this. So thank you again. I yield back.
Chairman yields back. Chair now recognizes the ranking member of the full committee, Mr. Walden, for 5 minutes.
Thank you, Madam Chair, and thanks for holding this hearing. Electronic cigarettes or e-cigarettes, the current outbreak of lung illnesses associated with e-cigarettes and the youth vaping epidemic are a front and center health concern in the United States, and particularly in my state of Oregon. In recent weeks, an as yet unidentified lung illness has killed 7 people, sickened more than 500 across 38 states. As we will hear from Dr. Sharpless and Dr. Schuket today, the investigation of the cause or causes of the illnesses is ongoing, but it appears to be vaping related. Many of the individuals who have gotten sick seem to have used black market products that contain THC. Earlier this month, public health officials in Oregon announced a person who died in July of severe respiratory illness had used an e-cigarette containing marijuana oil purchased from a licensed dispensary, meaning that product sold in the store should have gone through a testing process regulated by the state of Oregon. It was the first death in the U.S. tied to a vaping product bought in a marijuana shop. Much is still unknown, however, including which dispensary sold the product and whether it was contaminated or whether something was added into the liquid into the device after the purchase. In July, an 18-year-old young man went to a hospital complaining of breathing problems. Within 48 hours, he was sent to the intensive care unit, diagnosed with acute respiratory distress syndrome, a condition associated with acute lung injury. He was connected to a breathing tube and placed in a medically induced coma for a week. Later, the patient's mother found an e-cigarette cartridge with a label of a licensed company based in California that sells THC products. However, the cartridge later was found to be a counterfeit of that company's product. In North Carolina, 5 individuals bought the marijuana oils that made them sick on the street from unlicensed and likely illegal dealers. All 5 hospitalized, 3 in intensive care. It took a battery of tests to figure out that all 5 had acute exogenous lipid pneumonia, that's lung inflammation caused by breathing oil. Luckily, the individuals in New York, North Carolina survived, but not all have been so lucky, including the individual from Oregon who died. These cases of young, seemingly healthy young adults getting sick after vaping are piling up far too quickly. These cases are shining a light on the youth vaping epidemic in the United States. The most recent data from the National Youth Tobacco Survey, it's very troubling. About 27.5% of youth reported using e-cigarettes in 2019 compared to 20.8% in 2018. That's an 11.3% jump in just 3 years. Given these trends, the administration, the Trump administration, the states, and this committee are right to look for solutions to curtail youth access to e-cigarettes. So I appreciate the Trump administration's pursuit of an effective solution to the problem of youth access. as well as the partnership between the administration and the states to investigate these outbreaks of lung illnesses. However, there's another overlay to the e-cigarette problem. That's counterfeit products, including counterfeit THC products. Bootleg THC cartridges are becoming too common on the market, with vendors advertising counterfeit and bootleg products on social media platforms such as Snapchat and Instagram. And according to press reports, the states that appear to be the most inundated with counterfeit THC products are states where recreational marijuana is legal. According to the California Department of Public Health, there were 28 potential cases of acute lung disease among people who had recently vaped cannabis products. In August, the California Department of Public Health reported a cluster of at least 7 healthy kids in King County, California, all admitted to hospitals with symptoms of severe lung disease, and all 7 were linked to THC vapes that had been purchased from the black market. Lab tests conducted by a third-party testing company showed common contaminants in the counterfeit vapes, including pesticides, a fungicide, that when vaporized converts into a substance used as a chemical weapon by the French during the First War, World War I. In addition to the ongoing work, we need a full investigation into counterfeit THC cartridges, Madam Chair, as well as the vaping and cannabis black markets. That needs to be part of this investigation. So let's get a full set of facts to ensure we get it right when we move forward on policy solutions. I appreciate the witnesses who are going to testify today and others who have weighed in. And to echo the comments of the top Republican on the subcommittee, Mr. Guthrie, unfortunately, we have 2 very important subcommittees that the majority decided to schedule one on top of the other, one on prescription drugs that begins in about 8 minutes upstairs, and a very partisan bill, and this one. So sorry, but we will be going back and forth as we work on both of these issues, and I yield back.
Gentleman yields back. The chair now asks unanimous consent that members' written opening statements be made a part of the record. Without objection, so ordered. I'd like to now introduce our first panel of witnesses for today's hearing, Dr. Norman E. Sharpless, MD, Acting Commissioner of the Food and Drug Administration, and Dr. Ann Schuchat, MD, the Principal Deputy Director, Centers for Disease Control and Prevention. I want to thank both of you for appearing before the subcommittee today. I know you've both appeared before this committee before, and it's great to see you. You're aware, I know, that this committee holds an investigative hearing, and when it does so, it has the practice of taking testimony under oath. Do you have any objections to testifying under oath?
No.
Let the record reflect the witnesses have responded no. The chair then advises that under the rules of the House and the rules of the committee, you're entitled to be accompanied by counsel. Do either of you desire to be accompanied by counsel? No. Let the record reflect the witnesses have responded no. So if you would, please rise and raise your right hand so you may be sworn in. Do you swear that the testimony that you're about to give is the truth, the whole truth, and nothing but the truth? You may be seated. Let the record reflect the witnesses have responded affirmatively, and you are now under oath and subject to the penalties set forth in Title 18, Section 1001 of the United States Code. The chair now will recognize our witnesses for a 5-minute summary of their written statements. In front of each of you is a microphone and a series of lights. The light will turn yellow when you have a minute left and red to indicate your time has come to an end. Dr. Sharpless, you're now recognized for 5 minutes.
Good morning, Chairwoman Dingell, Ranking Member Guthrie, and members of the subcommittee. Thank you for the opportunity to be here today to discuss the regulation of electronic nicotine delivery systems, or INDS, and the agency's role in the ongoing investigation into lung injuries experienced by individuals who use vaping products. As you know, prior to coming to the FDA, I was director of the National Cancer Institute, and I'm a longtime cancer doctor. My experience treating patients has informed all of my work at the agency, including the issues before the committee today. We are here to discuss 2 top priority issues. First, the ongoing investigation into the cause of the lung injury associated with the use of vaping products, and second, FDA's ongoing efforts to address an epidemic of youth use of INDS products, including the administration's recent announcement about our intention to issue a policy that would address ongoing marketing of flavored INDS products. Let me start by discussing the vaping illness outbreak. Working with state partners, CDC and FDA have been investigating an outbreak of severe lung injury associated with the use of vaping products. Most cases have reported recent use of vaping products containing THC, the psychoactive ingredient of marijuana. Although these cases seem similar, it is not clear if they have a common cause or if they have different pathogenesis with similar presentation. The investigation has not identified any specific substance or product that is linked to all cases. Let me outline the main components of our investigation. FDA's Office of Emergency Operations has activated an incident management group to coordinate across the agency and work alongside CDC's incident management system. FDA's regulatory field force is playing a critical role in fact gathering and analysis. With state health departments, we are collecting samples for analysis at our Forensic Chemistry Center. The FCC is using state-of-the-art methods to assess the presence of a broad range of chemicals in these products, including nicotine, THC and other cannabinoids, opioids, cutting agents and other additives, pesticides, and toxins. Additionally, we are working with Customs and Border Protection to identify illicit vaping products at the international mail facilities. FDA's Office of Criminal Investigations is focused on identifying the products that are making people ill and following the supply chain to the source. FDA is not pursuing actions associated with personal use of any vaping products. Our interest is in the suppliers. But to be clear, if we determine that someone is manufacturing or distributing illicit adulterated vaping products that caused illness or death for personal profit, we would consider that to be a criminal act. Because many of the products associated with the cases contain THC oils, we have engaged the DEA to help with our investigation. Now let me turn to the FDA's efforts to address the disturbing rate of INS use by children. This summer, working with CDC, the agency received preliminary data from the 2019 National Youth Tobacco Survey, or NYTS. Despite strong compliance and education strategies, the 2019 data indicate another alarming increase in youth use of INS products. FDA's response to the 2018 NYTS data was aggressive and multi-pronged. We stepped up compliance and enforcement efforts by issuing warning letters and civil money penalties to retailers for sale of INS to minors. We collaborated with the Federal Trade Commission to remove kid-appealing products from the market and pursued INS manufacturers employing unlawful online posts by social media influencers. Most recently, earlier this month, we issued a warning letter to Juul Labs Incorporated for marketing unauthorized modified risk tobacco products, including in a presentation to children given at a school. We also expanded our efforts to educate youth about the dangers of e-cigarette use. Our youth e-cigarette prevention campaign, the Real Cost Campaign, is a comprehensive effort targeting nearly 10.7 million youth aged 12 to 17. Despite these significant efforts, the 2019 NYTS preliminary data, as well as another study supported by NIDA, demonstrate a continued rise in the disturbing rate of youth e-cigarette use, especially through the use of non-tobacco flavors. In particular, these data show that more than a quarter of high school students were current e-cigarette users in 2019, and youth e-cigarette users cited fruit and menthol mint flavors as being the most popular. In short, these data indicate the FDA must do more. That's why the President announced his support for the FDA's intention to soon finalize a compliance policy related to flavored INS. This policy would prioritize FDA's enforcement of pre-market authorization requirements for non-tobacco flavors. FDA is not banning flavors, as has been described in some news outlets. Rather, FDA intends to enforce existing law that limits the marketing of such products. This policy would not mean that flavored e-cigarettes could never be marketed. If a company can show through an application to FDA that a specific product meets the standards set forth by Congress, then the FDA would authorize that INS product for sale. FDA intends to prioritize enforcement actions such that flavored e-cigarette products will be expected to exit the market unless and until manufacturers of these products provide scientific evidence demonstrating that marketing their products is appropriate for the protection of the public health. I want to assure the subcommittee that I'm firmly committed to employing all the tools at FDA's disposal to tackle these important problems. We will not rest until we have answers to the questions in the investigation and until we've dramatically reduced the access and appeal of e-cigarettes to children. Thank you.
Thank you, Dr. Sharpless. Dr. Schuchert, you're now recognized for 5 minutes.
Thank you, Chairwoman Dingell and Ranking Member Guthrie and members of the subcommittee. I'm happy to have the chance to update you about our ongoing investigation of lung injury, as well as what we're doing related to the youth epidemic of e-cigarette use. I want to tell you what we know and what we don't know, what we're doing about the lack of knowledge, and also what we're doing about the youth e-cigarette problem. I want to make 4 key points. First, since the first time we learned of these cases of lung injury, CDC has been working 24/7, hand in hand with the state and local public health, as well as the FDA, to get to the bottom of it. Secondly, our ability to do this type of investigation relies on a critical underlying public health infrastructure, including data systems that need modernization, and a trained public health workforce, including a data-savvy public health workforce. Third, CDC has made important recommendations to the public already, including the comment that while this investigation is ongoing, people who are concerned about health risks should consider refraining from using e-cigarette products or vaping. People should not acquire products off the street and should not modify these further beyond what was intended by the manufacturers. Adults who use e-cigarettes or vaping products because they have quit cigarette smoking should not return to smoking cigarettes. And fourthly, this outbreak reinforces the need to address the broader epidemic of cigarette use among youth. What we know so far is that this epidemic is striking young people. Half of the cases are under 25. About 3 in 4 are male, but those numbers are changing as we get more data. We are getting new cases reported every day, and I expect this week's numbers to be hundreds higher than what we reported last week. What we don't know, unfortunately, is the cause. We know that most of the reported cases with information available so far describe e-cigarette use containing THC or THC and nicotine e-cigarette use. But no single product, brand, substance, or additive has been identified with all cases at this point. It may be that there is one cause or that there are many causes, and there may be complex root causes. CDC is working vigorously together with the states to respond. We've dispatched our disease detectives to assist some of the state and local public health. We've been coordinating case definition, data collection, and analysis. We've issued clinical guidance, and we're working with the clinical community to update that as new information becomes available. We activated our Emergency Operations Center, as we do for various public health emergencies, and we are coordinating and convening the public health and clinical community, as well as doing frequent media telebriefs to keep the public informed as well. We're working closely with the FDA on the traceback of products that people have used, and while our laboratory is not testing the patient products that are collected, that's the FDA's role at this point, our tobacco lab is working to develop assays to test the aerosols produced from some of the products. There are challenges with this response. The investigation includes trying to gather information about exposures to potentially illicit products, and so some respondents may not be totally forthcoming. State laws vary regarding THC and cannabis use that can also complicate the data collection challenges. E-cigarettes or vaping are part of a marketplace that is very wide and diverse, as you've heard. A multitude of product varieties and different substances can be used with the devices. There are also the issue of counterfeiting or black market products. Public health data collection for this response is relying on antiquated and fragmented systems that need modernization. The disease, unfortunately, is moving faster than our data systems at this point, and that is a barrier to our getting to quick answers. Let me turn briefly to what we're doing about the youth vaping issue or the youth e-cigarette use. We know that youth are much more likely than adults to use e-cigarettes. CDC has been messaging about our concerns with youth e-cigarette use since 2013, when we got the initial data about the alarming increase from 2011 to 2012 in youth use of e-cigarettes. So we have been at this, and we continue to be at this in terms of our concerns. Finally, CDC is dedicated to working around the clock together with FDA and state and local health officials to identify the cause or causes of this outbreak, and we will continue to keep Congress updated. Thank you.
Thank you so much, Doctor. It's now time for members of the committee to ask questions, and the chair will recognize herself for 5 minutes. So in 2015, the CDC stated, quote, "Youth, young adults, pregnant women, as well as adults who do not currently use tobacco products should not use e-cigarettes." I think that was also echoed by you, so Dr. Sharpless. So my question is, Dr. Schuchat, does the CDC believe that e-cigarette products are safe?
We are really concerned about the use of e-cigarette products among youth, pregnant women, young adults, and those who are not using tobacco products.
Even somebody who's not smoking or using e-cigarettes now, it's not like they're safe for people to use, isn't that right?
The aerosol that e-cigarettes produce can have a lot of potentially harmful substances. We have a lot to learn about both short-term and long-term effects.
So your answer is yes, it's not, or no, it's not safe. Yes, it's safe.
Right.
What is it
They are not safe
for those categories?
For those categories.
Are they safe for other people?
We are focused on those categories because there's the most data about them, and particularly for those with a developing
we don't know
brain.
if they're safe for the other people.
Right, but
Okay.
we also are quite concerned about people going back to smoking cigarettes, and we
Right.
don't want them to do that.
Okay. Is it true that youth are more likely than adults to use these unsafe products?
That's correct.
Now, Dr. Sharpless, the 2009 Tobacco Control Act gave the FDA the authority to put e-cigarettes under its regulatory authority, which the FDA did in the 2016 deeming rule. Is that right?
That's correct.
And in 2017, the administration extended the compliance deadline by 4 years for companies to submit materials to the FDA for review of the public health risks of e-cigarette products. Is that right?
That's correct.
And is it accurate to say that e-cigarette products are only on the market because the FDA has exercised its enforcement discretion to allow them to remain on the market and not because the products have been reviewed by the FDA?
All INS products currently on the market are illegal. They have not been reviewed by the FDA.
Okay, and in fact, your testimony says, quote, no ENDS product in the United States is on the market legally, right?
Correct.
Okay, and so you also agree with the CDC that e-cigarette products are not safe, is that right?
E-cigarette products are not safe. They are not without harm.
Okay, so here's my concern. Both FDA and CDC says e-cigarettes are not safe. We're seeing an explosion of young people using the products, and now we're seeing serious illnesses around the country, but FDA still allows these products to stay on the market even though they haven't undergone a full market review. So I think time is of the essence, and I'd like to ask you, Dr. Sharpless, when does the FDA intend to use its regulatory authority to assess the health impact of these products?
Right. I agree with you. I think time is of the essence. I think that the context of the history is perhaps important. In 2017, when that light regulatory touch was taken, the data at that time showed that youth use of those products was sort of leveling off or going down. And therefore, I think the FDA, being a science-driven organization, opted for that policy at the time. Then what happened, as you've described, is this epidemic of youth use.
Right.
And now we've accelerated our timeline. We've stepped up enforcement. We've stepped up education. And I can tell you we are on this problem.
So what is your timeline?
The next major development will be the finalizing of this compliance guidance, which will have the effect of removing non-tobacco flavors from the market, and we expect that to be weeks.
Okay, and then what are you going to do after that?
So typically when a guidance is finalized, it has 30 days to go into effect or some period along those lines, and then we apply an enforcement strategy, which we
So
have in other areas.
is the flavor strategy the only thing the FDA intends to do?
I can't speak to a guidance in process, but it is certainly the major target of that effort.
And why is that? Do you think that that's going to solve the youth vaping epidemic?
No, we do not believe that any single policy or process will solve the vaping epidemic. It's a combination of enforcement and education and multiple policy things that we're doing.
And are you continuing to review these products to see if they're inherently safe or unsafe?
So all products, INS products, will have to submit an application to the FDA by May 2020.
Okay.
And so very soon, everything should be coming in, but flavors would be removed from the market sooner than that because of our concerns about the youth epidemic of use.
Okay, just one last question. How far is the FDA prepared to go to protect the health and well-being of young people if it determines that these are unsafe?
The FDA is a science-driven organization. If the data support more aggressive measures, then we will take those.
How far?
We could ban all flavors, for example.
Thank you. I now recognize the ranking member for 5 minutes.
Thank you very much. Hey, thank you both for being here. We appreciate it, and your testimony is informative. Dr. Shuckett, you said that in all the 530 cases, or all the cases you have data for, there's no consistent You haven't found like, this is the cause, these are the things that we found, or the thing that we found? Is there a trend line that's developing in what you're seeing?
The data are coming in really literally as we speak. We believe that most people who have exposure histories that we've gathered describe using either THC e-cigarettes or THC e-cigarettes and nicotine e-cigarettes. There are very few that used only nicotine e-cigarettes. But I think it's important to say that what people say they used may not be fully descriptive of what the problem is. It may be, as you heard, a cutting agent. It may be something related to the device and how the device changed whatever product they used, and they may not really know what was in the product they got.
It's been reported that over 80% of the cases, the person reported they used THC.
That's right. That was in the report from Illinois and Wisconsin about the first 53 cases, and those numbers are from about 40 people. But that trend is continuing as we get additional data. I think it's also important to recognize there may be a particular problematic source in the Midwest and a different one in California, and I think we really need to be on top of this investigation
Absolutely.
and make sure that we understand all of the causes.
When you say people are doing THC and nicotine, is it they have nicotine e-cigarettes and THC, or they're not combining THC
Right,
and nicotine?
separate products.
Separate products, okay.
But one individual might have many different products that are being tested. So it's a very complex investigation, and understanding exposure versus causality is something that we're really trying to get to.
And I think we're looking at, we have the specific lung injuries we're looking at in this hearing. I know a lot of people are talking about the flavored and just the general growth in e-cigarettes, which we need to address. But also the THC or the marijuana that we're needing to address. Some states have made it illegal. I think Massachusetts just said they're going to pull back the flavors, but I don't know that they announced they're going to undo their marijuana policies moving forward. And in your written testimony, you said that e-cigarettes or vaping products containing THC in many patients in this outbreak suggest the need to understand the health effects of increasing marijuana use in the U.S. That was in your testimony. What concerns does the CDC about the effects of brains on teenagers who vape products containing THC?
You know, the adolescent brain is still developing. In fact, brains develop all the way through about age 25. So whether it's nicotine or marijuana, I think we really want to know the effects that occur. There's animal data to suggest some concerns, and there's behavioral data. But this is one of the reasons that there's a focus for the e-cigarette issue on avoiding use in adolescents and young adults. We don't know as much as we need to know about both short and long-term effects, and there are harms associated with nicotine in the adolescent brain as well as marijuana.
Dr. Sharpless, does the FDA have, what does FDA think of the effect of the brain and THC and vaping?
We, as Dr. Shiggett said, there is animal data and some human data to suggest that the developing brain is sensitive to these kinds of chemicals, and there are large ongoing prospective trials that NIH is funding to address these questions, so I think we'll know more, but our current recommendation is that children should not be exposed to high doses of nicotine or THC for a long period of time. That's a bad thing.
Thank you. And Dr. Sharpless, CDC's written testimony states that product information from the outbreak cases will be shared with the FDA to help FDA assess which of the products fall within FDA's regulatory authority. Has CDC shared such product information with the FDA?
We are sharing information continuously, both with CDC and states, and also now with the DEA. I think one of the things that we're doing that is important is we are getting these samples from the states that are linked to cases and taking them to our lab and testing them directly to see what they contain.
Are you seeing a trend? I know there's not been a consistent.
We've received about 300 samples. We've tested about 150. I would say the answer is about 70% are THC products. The rest are nicotine products or something else. A significant fraction of the THC products, like maybe half of them, are contaminated with vitamin E acetate, as you mentioned, which is a skin oil that has no business being in a pulmonary product, and we believe is added as a cutting agent, as you mentioned.
Can you know if you can, or can you tell if the 150 you've tested were secondhand or bootlegged, or were they actual commercially purchased? Can you tell that?
That's difficult to ascertain. Some of the products, particularly the nicotine products, are things you could buy at a store and appear to be manufactured products, but many of them are clearly illicit products.
Thank you. Well, my time's expired, and I will yield back.
Dr. Sharpless, you said those oils don't have any place in people's lungs. Can Can you explain why you said that?
Sure. Vitamin E acetate is a skin oil. It's used for sort of wound healing in the skin. It's an oily goo. And it is, we have looked, there is virtually no pulmonary toxicological literature on the use of this product as an inhaled substance. An oily thing, the lung is not the gut. An oily substance in the lung is not going to be easily cleared and could cause a thing like lipoid pneumonia, which has been seen in some of the cases.
I'm sorry to say this, but I had a pediatric pulmonologist in Denver tell me that what happens with this oil is it settles in kids' lungs and it impairs the development of their lungs. And she's even seen kids whose lungs are like the lungs of 80-year-olds, and that's never going to resolve itself. That's going to be what happens. That's why we're so worried. The chair now recognizes the gentleman from Massachusetts, the vice chair of this subcommittee, for 5 minutes.
Thank you, Madam Chair, and I want to thank you for calling this important hearing. Thank our witnesses for being here. Yesterday, Massachusetts Governor Charlie Baker announced a public health emergency and a 4-month ban on the sale of all vaping products. To date, we know that at least 9 people have died and 530 have been diagnosed nationwide. Back home in Massachusetts, there are at least 61 possible cases. And yet, we don't know concretely why. We don't know whether it's the nicotine products or the THC products. We don't know if there's additives that are responsible or if it's parts of the device that are causing the illness. We don't know if the products can be traced back to black market sales or over-the-counter purchases. So building off of what the chair just asked, Dr. Sharpless, help me answer some of those questions. How is it, what do we know, and how is it that we don't know more?
Regarding the vaping lung injury.
I'm sorry?
Regarding the vaping lung injury.
Yes.
Yeah. I think, the first cases were really appreciated in July, so it's still a relatively new entity. I think the progress in the federal cooperation has been pretty good. We now have a rigorous case definition. We've begun to test a lot of the products, both and interview the cases. And as I said, we've started a criminal investigation to learn more. And I think we will gather more information quickly. I don't know if Dr. Schuchat wants to comment as well.
So how did we get to the point where we are backtracking on this rather than actually putting in place the right consumer protections from the front end? If you're telling me that vitamin E shouldn't be an inhalant and is coating people's lungs to the extent that children's lungs look like they're lungs of an 80-year-old, where was the regulatory failure to allow that to happen in the first place?
We believe that adulterating a THC product would be an illicit activity. It would be illegal and tough to regulate, illicit drug dealers effectively. I mean, that is people who are cutting their product to sell it for greater profit.
And so you're saying that with regards to those specific cases with vitamin E acetate or an oil in it, that you have no evidence that any of that is an actual approved commercial sale?
No, vitamin E acetate is not approved for inhaled use. I should be clear, though, that it's only present in about half of the THC products.
Right.
We have a lot of cases that are not associated with vitamin E acetate. We don't know if it causes anything or is just a marker for adulteration or, sort of a marker for a bad product.
And so how, to both of you, how do we get to a point where we've got now a widely used series of consumer products that are getting 530 people sick, and understanding that it is somewhat new here, but there was clearly a massive regulatory failure that allowed for this to happen, was there not?
I believe, speaking about, not to conflate the two issues, but speaking about the epidemic of youth use of e-cigarettes, in retrospect, the FDA should have acted sooner. We should have begun regulating these devices sooner. Since I've been at the agency, we've greatly accelerated the date. We've put out a bunch of education campaigns. We've announced new policies like the PMTA guidance that will help people submit these applications. And now we are open for business to receive these applications. But we're going to catch up.
Doctor?
I would just say I'm extremely frustrated with the pace of our investigation. I wish we had answers already. I'm concerned that we may...
So if you're frustrated with the pace of the investigation, what can speed up the pace of that investigation?
Well, I think we have more than 100 people working on this, and the states are also making this a top priority. I think the FDA and DEA doing product sourcing can help. But I actually think there may be a very complex set of root causes here that are going to be difficult for us to address as a nation, and we need to take it very seriously.
Like what?
Well, I think if there's a set of supply chains that are completely underground, that are adulterating products that in ways that are just experimental, and are building on top of a population that is addicted to e-cigarette use as young people through the past few years, that we have a very vulnerable population and a very challenging supply chain to address.
And were none of those questions posed throughout any aspect of the regulatory process before these products were approved?
I don't,
Nobody thought that there would be a possibility of diversion or illicit use, or that there could be implications here that we're going to have adverse health impacts?
so as you know, the THC-containing issues are really regulated at the state level, not at the federal level. And I guess I would let the FDA describe that. CDC is not a regulatory agency,
Understood.
but we have been raising the alarm about e-cigarettes in youth since 2013 when we first saw the rise. We also support state and local health departments to exert tobacco control comprehensive approaches.
Dr. Chaplas, I'll let you finish.
Yeah, so I think, as Dr. Shiggert said, THC is a Schedule I drug. It's illegal by federal law, but is being tolerated in some of the states. There's a state sovereignty issue. To the extent those products are reviewed and regulated, it generally occurs at the state level now.
Right, and just very briefly, though, it's not, as you said, not all of these illnesses and deaths are linked squarely to THC. There's other issues here as well, and my concern is that if there's a failure in the regulatory and approval process on the front end, it should have been easily foreseeable that some aspect of these would have been illicitly used or cut or otherwise. And so I want to understand where that process broke down so that we can make sure it doesn't happen again. I yield back. Thank you.
Chair now recognizes the gentleman from West Virginia, Mr. McKinley.
Thank you, Madam
for
Chairman.
5 minutes.
And thank you for your panel. But I missed your remarks earlier because we do have another meeting going upstairs on prescription drugs. So you can see what's happened back and forth with this. But I forget, so I apologize that maybe your testimony might explain some of this. But I'm trying to follow the chronology of this, because from what I can gather from on the internet is that these cigarettes were introduced to the market around 2003. Some said 2006. Can one of you confirm when these things came on?
Yeah, the e-cigarettes began to be marketed in 2007, to my knowledge.
So back to you now, Doctor. If they've been 2007, again, I'll accept your 2007. I've got 2003, but why is the FDA not come up with a final? Because I heard the chairman's remarks that I can't agree more with her concerns. I mean, there's no light between the two of us on this. Why is the FDA not finalized some kind of determination that allows these things? Because they're still out there on a generally approved, or how do you describe their permitted use?
Sure. No INS products currently on the market are there legally. They are all illegal.
I'm sorry,
They're illegal. They are not authorized to be sold. They're on the market through a policy of enforcement discretion, where the FDA can prioritize the enforcement of its authorities. The history is, e-cigarettes became deemed products subject to Tobacco Control Act in 2016.
You missed my point. I'm sorry.
I'm sorry.
If one of the byproducts of these are fine particles getting into people's lungs, we've had numbers of debates in this committee over the last 8 or 10 years about what's happening with the coal combustion of a particular matter at 2.5 microns. But yet, from what I understand, my research on this is that these e-cigarettes are introducing not only 2.5 microns, but even less, smaller, and getting down in the lungs. So if we take action that are impacting the fossil fuel industry across America, why are we not finalizing and saying, until we know more about the carcinogens, the heavy metals, and other things, the cutting fluids or whatever it's added, why aren't we stopping this until your final determination? Why are these things still in the market if they're causing this kind of health risk?
Sure.
12 years after they were introduced, Doctor?
I think we don't consider these products safe.
Excuse me?
Harmful. We do not consider these products safe. We think they have harm. We do not think really anyone should be using them other than people who are using them in place of combustible tobacco. I think it has to be said that combustible cigarettes.
But you know
are
that's
very dangerous
naive
product.
to think that that's what's happening. Children, why aren't they just off the market until you make a final determination?
So the drive at the FDA is to be guided by the science of what's good for the public health. We think that some small off-ramp to allow addicted adult smokers to transition from combustible cigarettes to another product is of public health value, but we really want to limit the ability of youth and children to get access to these products because of the epidemic of youth use.
Okay, well, they make it CDC. Would it be more beneficial to our youth and others if these cigarettes were taken off the market?
We would like to
Watch
make
what I
it,
said. I think
we would like to make it possible for no youth to be, we would like no youth to be using these products.
So why hasn't Congress worked on that?
Sorry, did you say why isn't Congress?
Yeah, why haven't?
Well,
Why aren't they off the market? If you're saying they got part of it, you're thinking they should be better, why are they still out there? What's your opinion of why they're still out there? If they're causing this kind of problem, if they're introducing particular matter into our lungs, that we're having such devastation with the coal industry and all fossil fuels, but yet we're allowing children to inhale it at a higher concentration level, let alone something that's up a stack 1,000 feet up in the air. We're putting it directly into someone's lungs, and we're saying that's okay.
To be clear, Congressman, our plan is now to clear the market abruptly of characterizing flavors so that these kid-appealing products will be off the market as we finalize this guidance and implement this new policy.
I've run out of time. I yield back.
And don't worry, you can co-sponsor my bill to raise the smoking age to 21, if you haven't already. Chair now will recognize Mr. Ruiz for 5 minutes for questioning.
Thank you, Chair. There is a misleading notion when people say that it's safer than tobacco cigarettes, that somehow it is safe. You've said, and I believe you agree, and I wholeheartedly agree, that vaping and e-cigarettes is not safe. In fact, there's been numerous scientific studies by different medical schools that have tried to elucidate whether or not vaping has any net public health benefit. And so far, the vast majority of researchers have concluded that they believe that there is more population-level harm than benefit with e-cigarettes. So on one hand, you both know that e-cigarettes has a very narrow benefit in that it helps tobacco smokers of cigarettes quit smoking, period. Not just to convert the market from tobacco to vaping for an industry's benefit, but it's to quit smoking and inhaling nicotine. There is no benefit to nicotine, period. But that is very narrow. Then the harm, the biggest harm here, is that youth and young adult never smokers, non-smokers, people who have never touched a cigarette, are starting to smoke nicotine through e-cigarettes. These are new users. And there is even suspicion that there are more new users than there are those who are actually using e-cigarettes to stop smoking in general. So the benefit harm, you can see clearly. In addition, there's a study from Pittsburgh that shows that those who are never smokers, who are now smoking and vaping, 47.7% of those youth and young adult smokers start smoking tobacco cigarettes. So you count those with never smokers, compare those to those who are stopping to smoke, then that's why they're saying there's a net public health harm with this industry to begin with. Then there are other studies showing that vaping, those e-cigarettes, still have volatile organic compounds that are still carcinogenic and cancer. And if you get a young adult who have more propensity to be addicted, they have more propensity to stay smokers for a longer period of time, therefore inhale benzene for a longer period of time, you can start to see that they can also acquire lung cancer and other types of cancers. And that's not to mention that the concentration of these pods, cute little pods that they do in USB courts, etc., have higher nicotine than tobacco, and you're starting to see reports in the emergency department of teenagers coming in with cardiac arrest and cardiac arrhythmias. I know, I'm an emergency medicine physician. So where is the benefit of this industry to our nation's health? Except for that very small, narrow tobacco smokers to get them to stop using tobacco and stop using e-cigarettes. So the best case scenario was that. The worst case scenario is that new smokers, non-smokers, and lifetime e-cigarette smokers, which the e-cigarette industry and vaping industry would love, to take tobacco smokers, since they're large around the world, and just simply buy our products because it's safer, i.e., the misnomer that it's safe. So we need to prevent the youth from getting their hands on there, and I'm introducing legislation that will just do that to help increase the fines for first-time penalties for selling these to the youth. And I'm also introducing legislation to do more research on the long-term effects. So I'd like to ask you, Dr. Shushat, what are the secondhand smoke effects of vaping?
You know, you've raised really critical issues, that the aerosol that e-cigarettes can produce includes many toxic things, and the direct and indirect effects are not fully understood. So the issue of additional research to really get at those long-term effects makes sense, and we absolutely share the concern about youth, that no youth should be using e-cigarettes and that it can open the door for many problems.
I ran out of time.
Chair now recognizes the gentleman from Virginia for 5 minutes.
Thank you, Madam Chairman. I appreciate it. Dr. Shushat, you said earlier that there were a lot of different issues going on here, and so I'm going to touch on a couple different issues, and I'm going to jump around, so it may not always, one question may not lead to the next question. Let me start by just saying that there's an agency that's not here that I think has some issues that we need to look at, and that's the DEA, because for 20 years I've been for medicinal marijuana, but we've not been able to do adequate studies to find out what the benefits are. And if you can't find out the benefits, you don't have any data on the harm. And so we really don't know, when you start adding THC into these vape products, we don't really know the long-term consequences of THC, particularly when you start as a youth. We know it's not good because the brain's developing, as you said, Dr. Shushat, till 25. As a part of that, the Virginia legislature this last year raised the age for all tobacco products to 21. So, you know, obviously the states can lead on that, and Ms. DeGette mentioned that she has a bill that would do that at the federal level. And that seems to be a proper step for youth. And in reality, Dr. Shushat, I think you may have mentioned this yesterday as well, don't we really have two problems? We've got this mysterious lung diseases, and then we have the whole youth and flavor issues. And I bring that up in particular because my wife is a juvenile and domestic relations district court judge, and they are seeing all kinds of problems in the schools because, unlike a regular cigarette, where the teacher can immediately identify what part of the classroom it's coming from, they're not getting that with the vape cigarette. They're just putting it in their pockets or whipping it out real quick when the teacher's back is turned, and they have no idea that vaping is going on in the classroom unless they actually catch them, which sometimes does happen. But am I correct? We're really talking about two different issues here today.
Yes, there's two extremely important critical issues. Where they overlap, we don't know yet.
Right. Now, one question that my colleague from West Virginia brought up, and that is that e-cigarettes have been on the market for quite some time, 12 years at least, but the vaping illnesses seem to be new. So here's the question, and I'd like a quick answer if I can get it, because I got other things I want to ask about. Does the CDC or the FDA know if the current outbreak is a new phenomena, or is it just that there's a new awareness and people started looking for these lung disorders from people who may have been vaping?
Increasingly, the data suggests it's a new outbreak. There have been individual cases in the past, but nothing like what we've seen now.
And am I correct that the knockoffs, the illegal imported, many times pods, is a relatively new development as well?
Well, even the mod pods are relatively new, so knockoffs of mod pods would be new as well.
Okay, and so previously we may not have had as much of the various chemicals being added in to dilute, or have we?
I don't actually know, I'm not,
Do you know, Dr.
I don't have
Sharpless?
that knowledge.
Sharpless?
We don't really know what the practices of adulterating these products have become. Now we know that when we test them, we find signs of adulteration that appears to be occurring, but whether that's new or an older practice, we can't say.
All right. Now, Dr. Sharpless, I'm aware that there are a number of vape products or vapor products for sale in the U.S. that came onto the market after the FDA's August 8, 2016 deadline. That means they're already being sold illegally. What is the FDA doing right now to get those illegal products, many of which are compatible with use with legally sold products, off the market?
When we identify products that are on the market after the period that you alluded, we act to remove them from the market by sending warning letters and other notifications. We've done that in a handful of instances, or a significant number of instances. It can be difficult to ascertain when something came on the market, so that makes it a little more tedious than you would have expected.
All right. Now, I mean this as a friendly question. We can't control all the importation of illegal substances coming across our borders currently. Do you have much hope that we're going to have much success with keeping imported, possibly tainted mods, pods, whatever the right terminology would be, coming across the border? And what I'm trying to say is, somebody else earlier said that, how come y'all haven't stopped this? If we can't stop fentanyl, how are we going to stop pods for vaping?
Congressman, I agree, it's a very challenging issue. We have engaged the DEA to help to discuss these topics and rely on their expertise. Our international mail facilities work with Customs and Border Protection to see what's coming in, and we are doing fact-finding presently in the IMFs to find what vaping products are being sent to the United States and what are the characteristics.
All right. I think we'll probably have more hearings. I appreciate your time. This is a serious issue. We are all very concerned about it, and I yield back.
Chair now recognizes the chairman of the full committee, Mr. Plum, for 5 minutes.
Thank you, Madam Chair. Earlier in September, the President announced that FDA intends to finalize a policy in the coming weeks to clear the market of flavored e-cigarettes until products undergo full pre-market review. And while I certainly agree with the statement Dr. Sharpless made that we must act swiftly against flavored e-cigarette products, I am disappointed that it's taken so long to get to this point. E-cigarettes have been available for purchase for over a decade, and it's been over 3 years since they were brought under the regulatory authority of FDA. And during this time, the e-cigarette market has dramatically expanded and has become more attractive and accessible to children and teens. E-cigarette use amongst middle and high school students has risen sharply, with preliminary data released last week demonstrating that a third of 12th graders are e-cigarette users. And I agree that clearing the market of flavors could help reduce youth utilization of e-cigarettes, and raising the minimum purchase age for tobacco to 21 could also help reduce youth access. But these steps in isolation aren't enough. It's my strong belief that Congress must take comprehensive action, and I now have some questions about FDA's guidance and our need to do more. So first, let me start with Dr. Sharpless. It's my understanding that FDA intends to outline the administration's policy to prohibit the sale of non-tobacco flavored products through guidance. Is that correct, yes or no?
That is correct.
Dr. Sharpless, FDA guidance, in my opinion, lacks the permanence and legal force of a statute or a formal rule issued by the agency. Is that correct?
To be clear, the guidance will just allow us, we'll describe how we're going to enforce existing law. So these products are illegal, and we're just announcing how we're going to prioritize enforcement of existing law.
So, but do you disagree that the guidance lacks the permanence and legal force of a statute or a formal rule issued by the agency?
Well, the products are illegal by the act of Congress, so...
So you're saying that with the guidance, you will now enforce the underlying law?
Right. The guidance will describe our enforcement policies.
Well, what kind of steps can the FDA take to ensure that the industry is complying with this flavored tobacco prohibition, given what you just said?
Sure. The FDA has experience with this kind of problem. Generally, we send warning letters to the legitimate retailers and manufacturers. They will come into compliance, and usually, and then that will have a dramatic effect to the products on the market.
Well, I still don't understand how you force them to comply with the guidance.
The way it works is we send a warning letter. It says that your product is no longer subject to enforcement discretion, And at that time, we expect it to be removed from the market, any flavored products.
And if they don't?
Then we have a number of other activities that escalate, further warning letters, civil money penalties. Manufacturers, we can seize.
And you intend to
injunctions.
impose those enforcement measures?
What's that, I'm sorry?
You would impose those fines and those other enforcement measures?
For manufacturers, usually an injunction, yes, but we would impose those if needed.
Okay. Let me ask, the proposed flavor ban included mint and menthol flavored products. Can you commit that these flavors will remain part of the compliance guidance when it's finalized?
I can't describe what's going to come out in a future, in a guidance we're working on with certainty. I can tell you that the data suggest that mint and menthol are very popular with children, and if the intent of the policy is to...
But I mean, you're not committed that that's going to be part of the compliance when it's finalized?
Well, the compliance guidance will be out in weeks, and, I think we will...
Well, it sounds like you're saying you're not committed to it, unfortunately. I just think the only way we can realistically verify that tobacco products, both flavored and non-flavored, don't flow to children is through direct, this question is about face-to-face sales. I think the only way that you can verify that tobacco products, whether they're flavored or non-flavored, don't flow to kids is through direct face-to-face sales. And my bill would ban the sale to online and other, would ban online and other remote sales. So can you commit that any guidance banning the sale of the flavored e-cigarettes would extend to online and other remote sales?
The guidance we envision would extend to all retail channels, so online and in-person sales.
Okay. Now, as I understand it, there are reports of as many as 3 million distinct e-cigarette products currently available for sale in the U.S. Does the FDA face any resource or capacity challenges in monitoring the e-cigarette market to be able to enforce the agency's existing authorities?
So as you know, the Center for Tobacco Products, FDA, is entirely funded off user fees. E-cigarette products do not pay a user fee, as in contradistinction to other tobacco products. I think a user fee program for e-cigarettes would be helpful to the FDA to enforce these activities as you described.
Are those user fees that you're receiving now available for monitoring e-cigarettes?
We are using the appropriate monies for our activities related to tobacco products.
What about the user fees?
I'm sorry, sir?
What I'm trying to find out is if the money you're getting from user fees is available for monitoring e-cigarettes, or you're just using the money from appropriated sources?
No, the money we're getting for user fees is available for the use of monitoring e-cigarettes.
All right. Thank you. Thank you, Madam Chair. Sorry to go over, but this is such an important issue. I apologize for
Through
going
the
over.
chairman. Chair now recognizes the gentlelady from Indiana, Ms. Brooks, for 5 minutes.
Thank you, Madam Chairwoman, and thank you for hosting this incredibly important hearing. According to the Indiana State Department of Health, and in a recent publication, as Dr. Chris Box, the commissioner, stated, the numbers are staggering in Indiana as well. Nearly 1 in 5 high school students and 1 in 12 middle schoolers say they use e-cigarettes, according to the 2018 Indiana Youth Tobacco Survey, and it's a 350% increase since 2012. She also writes that 1 e-cigarette can contain the same amount of nicotine as an entire pack of cigarettes. I think there is so much that is not known about e-cigarettes, and so my question for both of you, given how little we know about e-cigarettes and long-term effects of e-cigarettes, what research or studies are currently underway to help educate everybody about the e-cigarettes? Dr. Sharpless, when do we expect the studies to be complete? What studies are underway? And same to you, Dr. Schuckett.
Sure. There's a number of studies by a variety of federal agencies looking at the composition of e-cigarettes and their use as a switch or cessation device type approaches from both NIH and FDA and other agencies. But, these are still relatively new products, and we don't have the long-term experience with them that we would like. The FDA has launched a very vigorous education campaigns, particularly targeting youth, about the dangers of e-cigarettes, including recent online, ads and TV ads.
My concern, and Dr. Shuket, anything else you'd like to share about studies and research?
CDC is just doing surveillance and monitoring. We're not doing research. We do test the aerosols, and we're really focused right now on the lung injury outbreak and studies related to that.
Well, and in fact, right after Dr. Box issued this report and indicated that our Governor Holcomb at one of my high schools announced a $2 million campaign to curb youth vaping at Fishers High School, talked about this, announced it at Fishers High School, a lung injury death happened to a young Hoosier within the week of this incident. And this has impacted 50 others in our state, nationwide over 400 cases. My concern is that all of the research, if we wait, the research being done on marijuana still isn't conclusive. We're still waiting on the federal government to really come up with conclusive studies to be finished on marijuana decades after we started it. Why do we think that this is going to be any different than that? Dr. Sharpless, why do we think the research is going to be any different and it's going to be done any faster? Because more people are dying?
No, I think I agree with you that this is going to be a tough topic to study. It's going to require a long-term effort. I think some data will be more easy to glean forthcoming, but the answer to the questions that we really want to know, like what's the safety of these products over years and decades, is going to take a while. In the interim, I think the FDA is charged with using existing science to come up with a regulatory framework that is best for the public good.
So whether it's a surveillance or the investigations being done, is there a consistent substance, brand, or product identified in the cases so far? Dr.
There's not yet a consistent one, and one of the reasons that we took action of making broad recommendations right now is it may take a while to get answers, and we wanted to warn the public in the meantime.
Dr. Sharpless, anything that any different statement on that?
I would agree that the majority of products, as I mentioned, are THC, but there's certainly some that are nicotine only, and there's no particular brand or product or contaminant that we've identified in all cases.
And in the studies that you're doing, how many do we know if the individuals are reporting buying them at the vaping products at stores versus online, or are they getting counterfeit or black market products on the street?
I think anecdotally, we see a lot of social sources, not retail purchase, but more, from someone they know. So I think we're concerned about that in terms of what the ultimate supply chain may be.
And do we know, have there been questions from them by those that are asking the questions, whether or not they've modified after purchasing either the device or the product?
There are a set of questions, and I don't have yet the results of the interviews. The states on the next panel may have more information because they are actually doing the interviews with their patients.
Okay, thank you. I yield back.
Gentlelady yields back. Chair now recognizes the gentlelady from Illinois, Ms. Schakowsky, for 5 minutes.
Thank you. I understand that you're saying that we don't have any evidence or that the evidence is that this might help some smokers, but on the website, smokefree.gov, which is part of the Department of Health and Human Services, it says, quote, e-cigarettes are not approved by the FDA as a quit smoking age. So far, the research shows there is limited evidence that e-cigarettes are effective for helping smokers quit. There are other proven safe and effective methods for quitting smoking. So that's the quote. So clearly, e-cigarettes are not proving to provide smoking cessation. And it seems to me that, if we are unable to limit cigarette use to existing smokers, that we should just ban it. I don't understand why the default position right now should be to allow it continue in any shape or form. Dr. Shuket, who I barely remember out of uniform, we should be saying no right now, and then if there's a way to phase in some of it, okay. But meantime, people are dying, including a person in my state. How many children are we going to allow to die before this is considered the emergency it is, and we just say no? So I'd like to hear from both of you.
Sure, I'll start if you mind. I agree with much of what you said. These are not approved cessation devices. The FDA does have other cessation approaches that are approved. The FDA is driven in its decision-making by science for what's good for the public health. The argument against banning all e-cigarettes is that we think in that instance, there are people, millions of Americans using e-cigarettes today who may find no other source of nicotine that's satisfying to them other than moving back to
Okay,
products.
but Dr. Shuket, you said that the aerosols have toxins in it. I mean, I understand what you're saying, and maybe that's true, but in the meantime, we have an epidemic of people ending up in the hospital and 8 people who are dead. Let me ask Dr. Shuket to.
Yeah, what I would say, of course, CDC doesn't have the regulatory authority, but we have aggressively announced warnings, and we want parents, teachers, state health departments, and clinicians to know about the dangers that this outbreak is associated with. Our recommendations say if you have concerns about health risks, we suggest you not use vaping or e-cigarettes at this time.
That's nice. But I want to ask another question. I understand, and we've heard from several media outlets, and I want to put some articles into the record, that report that the White House is still planning to hold a listening session with several conservative think tanks and industry groups that are concerned that eliminating or banning any part of this would hurt the president's re-election. And so it seems that no public health groups are on the list, and you were not invited, as I understand. Do you think that's appropriate, that industry groups and organizations that support the president and support vaping should be in a meeting?
I can't really comment on meetings the White House plans to take.
Yeah, CDC is a data-driven organization, and we're gathering the data and alerting people about risks.
Well, I do want to ask that we put into the record some articles about this this potential meeting, and let's hope that the whole
Without objection, so ordered.
Thank you. And let's just hope that all of this is data-driven. But do you have any metrics on at what point we say we're going to address this, not just by education? Are we going to see an implementation of taking this away? Did you send the letter yet that you said is going out, and what are have the responses been? I don't feel a sense of urgency. I just don't feel a sense of urgency here.
Oh, Congressman, we are very have a strong sense of urgency of the FDA on this topic. You know, we sent the letter to the manufacturer I mentioned, to Juul Labs, regarding their marketing practices. We also this compliance guidance, as we finalize it in a few weeks, will have a dramatic effect on the marketing of flavored products, what's available to the American consumer today, and I think will be really good for kids because we know flavors are particularly attractive to the young people.
Okay, so, and they will be banned in a few weeks?
They will be withdrawn from the market because we will we will stop exercising enforcement discretion over those products.
And they will be banned?
That will have the effect of removing them from the market, yes, ma'am.
Okay, I yield back, thank you.
Chair now recognizes the gentleman from South Carolina, Mr. Duncan, for 5 minutes.
Thank you, Madam Chair. You know, the use of e-cigarettes is common among our youth, and the reported deaths and illnesses that have been associated with that are incredibly worrisome. The issue, as I see it, isn't necessarily about vape or vaping products as much it is about how these devices are abused. I thank the witnesses for being here to help us understand the issue better so that we can hopefully find appropriate solutions. But I believe the immediate answer is for our youth to stop buying black market pods and stop trying to get high by lacing these pods with THC. That seems to be the common thread. I believe it's crucial that we look further into the THC counterfeit black market products that people are buying and vaping. I understand these products have a short history, but we need to have all the facts before we can fully remedy the situation. So I'm going to ask both witnesses here today, I understand that patients with reported lung illnesses have admitted to using e-cigarettes containing just THC, THC and nicotine, and just nicotine. But does CDC and/or the FDA believe that THC counterfeit black market vaping products pose a higher risk than legally sold, unadulterated nicotine cartridges used in e-cigarettes? Both witnesses.
We're concerned about both right now, and it's an ongoing investigation about the lung injury outbreak. We're very concerned about e-cigarettes and youth on an ongoing basis because the trends are increasing.
I agree with Dr. Schuchat's remarks. I think the no single product has been linked to all the cases. When we test cases, products that are actually linked to cases in our lab, we find that the majority are THC products, but not all of them. There are certainly nicotine-only products as well.
Thank you for that. Are there any enforcement actions that CDC and FDA believe we should be taking against counterfeit manufacturers?
A challenging issue for the FDA, particularly around THC, which provides some jurisdictional challenges. I think we can certainly try and enforce what comes in at the borders through the international mail facilities. When it is an FDA-regulated tobacco product, we certainly have significant enforcement authorities. And as I said, we've engaged the DEA for their help on products that are more challenging for us jurisdictionally.
Dr. Schuchat?
I really think this is an extremely challenging issue. I don't have the tools, and I'm not sure what the tools are, but I think counterfeiting and there clearly are a lot of dangerous products out there.
Yeah. Given what little we know about these counterfeit products, what research or studies are currently underway to help us understand more? What are y'all doing to help us understand more?
Just briefly, the state and local public health are interviewing patients associated with the lung injury outbreak and identifying what they used, where they got it, how they used it, and providing that product information to FDA or as appropriate to DEA.
We're taking the data we're getting from CDC and other data sets and integrating that, and we have a across the agency effort involving all our scientists to think about what's the cause of this outbreak and what we can do to prevent further cases. And then I mentioned the extensive testing that we are doing in our criminal lab, our forensic chemistry lab, to identify the components and the possible contaminants.
I think there needs to be a strong public service announcement, a marketing effort, targeting the age groups of middle school and high school that are using these, even college and even young adults. 2 weeks ago, the CDC put out a statement regarding whether users should consider not using e-cigarette products at all while the investigation is ongoing. Conversely, the FDA put out a statement urging consumers to avoid buying vaping products from the street and to refrain from using THC oil or modifying using any substance to adding any substance products purchased in the stores. Why have the CDC and FDA been putting out conflicting warnings and recommendations to the public?
I would say there's no light between the recommendations that the two agencies have been putting out, and if it's interpreted as different, we want to correct that.
Yeah, I would agree. I think we're in lockstep on this about the public health emergency here and the avoidance of these products by all parties except for those people who may be using them to not use combustible cigarettes. I think we do look at slightly different data sets, and we as data emerges in real time, we want to make it available to the public as quickly as possible because of the public health import of this information. But I agree, we're substantially in agreement on this.
Does it concern you at all that the federal health officials, public health officials, are putting out conflicting statements and there will be confusion among those who are using e-cigarettes legally, not the ones that are buying the black market, not the ones that are adding things to it? There's confusion over those that are legally using vaping products? Does that concern you at all?
We strive for clear communication and want to do better.
I would agree. We have constant communication, and I think we will strive for very coordinated communication.
I think the message here today is stop putting THC products in legally purchased pods and stop buying black market pods. There's a health risk, and it is coating the lungs of our children, keeping the oxygen from making it into the system to provide oxygen to the brain. It's damaging the health of our kids, and that's the message today. Stop doing this.
Gentlemen's time's expired. Chair now recognizes the gentlelady from New Hampshire, Ms. Custer, for 5 minutes.
Thank you, Chairwoman DeGette, for holding this critical hearing, and thank you to our witnesses for joining our committee while we seek answers from the public about this public health emergency. And I think you're hearing in a bipartisan way, the research is really important, communication and transparency of the data to the American people. I can certainly say as a parent, this is a very scary time in terms of, I personally don't think we should be holding out any of these products as quote-unquote safe to the public because we haven't had the research and we have not thoroughly tested them. Based on the data, just as we were on the precipice of minimizing tobacco's hold on our nation's youth, the tobacco industry has devised a new way to place our children once again in the crosshairs. As a result, e-cigarettes are now the most commonly used tobacco product among youth, surpassing the rate of youth use of conventional cigarettes 5 years ago in 2014. In fact, e-cigarette use among youth doubled from 2017 to 2019, doubled, demonstrating this problem is only getting significantly worse. In my own home state of New Hampshire, the Department of Health and Human Services estimates that at least 1/4 of all high school students use vaping products, and that number is on the rise. Now, you may know that our state is still in the throes of an opioid epidemic that began with misleading marketing and lack of regulatory oversight. My fear is that we're repeating those same mistakes and making way for a new generation grappling with addiction. And that's why I'm proud to co-sponsor the Reversing Youth Tobacco Epidemic Act of 2019, which includes numerous important provisions to curb the rise of youth tobacco use. And with that, I want to ask a few questions. Dr. Schuchat, based on CDC's surveillance and research, what do you believe are the reasons that young people are smoking e-cigarettes at such alarming rates?
We know that flavors are a principal attractant to young people. The latest generation of e-cigarettes also are extremely high in nicotine content. They often include nicotine salts, which are a little bit more palatable or less bitter, and the flavors are, really targeted at youth. So we think the addictiveness of the high nicotine level and the appeal of the flavors are key. We also think some of the companies have had youth targeting ads.
And the marketing. According to the National Institute of Health, 81% of adolescents who have ever used tobacco products began with a flavored product. Dr. Schuchat, what more can you tell us about the contribution of flavors to this dramatic rise? And you've mentioned this. Anything more to add?
Yes, I think that we have seen a little bit of a shift in the most recent preliminary data with an increase in the menthol and mint flavors among what youth are using. So we do think flavors are a critical beginning to youth use, and then the nicotine provides that addictive substance that keeps them going back.
Thank you. And Dr. Sharpless, will you ensure that the newly announced federal policy to clear the shelves of flavored e-cigarette products will be effective?
We believe this policy will have a dramatic effect on the flavored products sold in the market today.
And does that include menthol and mint cigarettes will be cleared from the shelves?
We are finalizing the policy, and I don't want to prejudge the policy under preparation, but I can say that the data support mint and menthol being a significant problem, as Dr. Schuchat alluded, that it's become very popular with children.
Thank you. Last year, as part of the FDA's comprehensive plan for tobacco and nicotine regulation, the agency launched the Youth Tobacco Prevention Plan. Dr. Sharpless, what are the goals of this youth-focused plan, and can you discuss the status of some of the efforts like the Real Cost campaign that FDA has or plans to implement?
Thank you for the question. The FDA is a long-standing anti-tobacco campaign, educational campaign. Initially, it was focused around combustible cigarettes, getting youth not to use that. We believe it was very successful in that regard. The campaign reaches 11 million kids aged 12 to 17 who are users of tobacco products or open to using tobacco products. In the last year or so, we have really shifted that focus to e-cigarettes to catch up with this epidemic. This includes some new TV ads that are very, they really tested off the charts with the youth markets. They are strong ads to discourage youth use of e-cigarettes, to make sure kids are aware. Sometimes kids aren't even aware that some of these products contain nicotine, for example. So juuling has become a verb in high schools that is not really understood to be a dangerous product necessarily. So there's really a lot of education effort devoted by the FDA towards this topic.
Well, in my view, manufacturers and retailers are creating a new generation of nicotine-addicted consumers at a time when our nation's youth face unique obstacles now more than ever. So it's important we take action to constrain further reversals and protect our youth. And with that, I yield back.
Chair now recognizes the gentlelady from Florida, Ms. Castor, for 5 minutes.
Well, thank you, Chairwoman DeGette. This is a very important hearing, and thanks to our witnesses for being here. America has a serious and growing vaping problem. I've seen it firsthand. My 2 daughters are just a couple of years out of high school, and I noticed a sea change in behavior among high school kids, middle school kids over the past decade. And it reflects the research, the yearly Florida Youth Tobacco Survey that is run by our Department of Health found that from 2012 to 2018, there was a 361% increase of kids aged 11 to 17 who tried electronic vaping. Even worse, there has been a 582% increase in kids that currently use electronic vapes, and 651% increase when the survey focused only on high school students. And on top of that, the survey also found that e-cigarettes are by far and away the most common form of youth smoking. So clearly this is a very serious public health problem. Do you term it an epidemic or an emergency, Dr. Shukat?
Yes, we are calling the youth use of e-cigarettes an epidemic.
As are we.
Okay. Dr. Sharpless, on September 10th, in a post titled "How FDA is Regulating E-Cigarettes," you wrote that clearly some of the rapid rise in youth use of these products, meaning e-cigarettes, has resulted from irresponsible practices of the manufacturers who have targeted children in particular. Give us some examples of these insidious practices by Juul and other manufacturers.
So on September 9th, we sent a letter to Juul Labs Incorporated detailing their use of unauthorized marketing claims, so-called modified risk tobacco product claims. So things like saying their product is essentially safe or much safer or 99% safer. Some of these were made in presentations to children, and they
So they're just outright saying things that are untrue.
There is no data to support those claims. There are no data to support those claims.
So
that I'm aware of.
that's untrue, Dr. Shukat. Yes. How are these manufacturers specifically targeting kids? What type of marketing are they using that really alarms you?
Yeah, we're aware of a lot of presence on social media and recruiting youth social influencers, influential people, celebrities and so forth to make this look cool or fun. And certainly as Dr. Sharpless mentions, a lot of youth aren't aware there's even nicotine in e-cigarettes. Flavor and water, that's what I thought I was getting. So I think we're seeing the kind of tactics that were used with cigarettes being used again, and we think we need to take really aggressive action to protect the young.
Dr. Sharpless, you said we need all the regulatory tools that have been mentioned here, but you said in your public relations campaign you're going to use TV ads. That's not going to do it. You know what they are using.
Yes.
They're on Instagram, they're on Snapchat, they're using these influencers. Don't you have plans for a more modern type of education campaign to really get to young people?
I totally agree. This is a market that requires a lot of different channels to reach. We have done some of this. So with the Federal Trade Commission, for example, we took down some sites that were using these social media influencers that were sort of hyping e-liquid products without disclosing they contain nicotine, which is a violation.
Who are the public health influencers that you all are going to bring to bear? Because these products, you're right, young people, they think they're cool. They think they're not so harmful. They think, oh, that has happened somewhere else. It's not happening in my friend groups.
In terms of public health, of course, the Surgeon General's really been out there and our partners at state and local public health. I think there's a lot of kids behind me who might be influential as well.
Really, you got to get with the program here. You're not going to be able to combat this with the same old ways to communicate to young people these days. You've got to bring the most modern techniques to bear. I don't think the Congress has all the answers in that either. So I really encourage you, and I encourage the committee to move aggressively on this. Otherwise, other people are going to die, and other young people are going to get hooked. That they don't even they think it's cool. They think it's not harmful, and now all of the evidence we have so far, that's just not the case. So I'll yield back my time and encourage you to be more hip. Thanks.
Gentlelady now, let's see. Now recognizes the gentleman from Maryland, Mr. Sarbanes, for 5 minutes.
Thank you, Madam Chair. I want to thank the witnesses for being here today. I'd like you to speak, both of you, but maybe Dr. Shuka to begin, on map out for me, because I think this is horrifying what's happening. And it's sort of, we're playing the same reel over again that we saw with, cigarettes before the tobacco settlement, with opioids before now the heightened scrutiny that it's receiving, and all the litigation that is ensued, and presumably some kind of compensation that will come too late for many families and many communities. But even as we're dealing with those things, the after effects of those crises, those public health crises, we've got a new one unfolding before our eyes. And you can just predict that we're going to be having hearings 10 years from now, looking back and picking up the pieces of a terrible public health crisis with incredible impacts on communities across the country. The fact that it's starting, its breeding ground is among children is what makes it even more horrifying. So there's a lot of discussion about how we need to better regulate this and address the industry's practices and marketing and all the rest of it, which is important. But maybe you can map out the scenario of what the public health crisis could look like 10 years out, 5 years out, 10 years out, if we don't take really dramatic steps now to address this on what arguably is still kind of the front end of it, although we're kind of getting into the thing. Map that out for me, because in a way, what I'm asking you to do is put on the record a scenario that we can come back to. I don't want to have to do that, but that sadly we may find ourselves coming back to later and saying, this was all predictable. So talk about that.
We've been warning about e-cigarettes in youth since 2013 when we first saw the increase in our data from 2011 to 2012. But the industry has changed substantially since then, and the products in this fourth generation of e-cigarettes are much more risky even than the earlier ones in terms of nicotine level, flavors, the nicotine salts, and the concealable product that make it really hard to know that anybody is using in class and so forth. So if these trends continue and we don't turn this tide, we have a generation addicted to nicotine with potentially the impacts on the adolescent brain or the developing brain that last for life in terms of memory, attention difficulties, learning problems, and the implications of that as adult workers. We have the potential to progression to cigarette smoking, which we know is incredibly lethal in people who smoke. And we have all the signs of that happening in terms of the last few years of data. The issue right now with the lung injury outbreak has people dying. It's not a question of 20 years from now, it's a question of now. And the forces that have led to that, we don't fully understand. Just as with the opioid epidemic, we didn't understand prescription drugs to heroin, to fentanyl, to analogs, to stimulants. And so I think we have a lot of people getting addicted.
One thing we have come to understand, and we probably could have understood in the moment with the opioid crisis, if we hadn't, in effect, had the wool pulled over our eyes by an industry with very effective marketing techniques, is how a whole industry can either affirmatively be trying to encourage dependency on their product, or at a minimum, turn a blind eye to alarming trends that are happening, that they know are happening, and look for sort of plausible deniability about their own responsibility. And I think we're seeing it all play again, same movie. So anyway, we're going to keep our focus on this. Thank you very much, Madam Chair, for convening the hearing. I yield back my time.
Chair now recognizes the very patient gentlelady from New York, Ms. Clark, for 5 minutes.
I thank you, Madam Chair, and I thank Ranking Member Guthrie for convening this subcommittee hearing today on the threats of e-cigarettes. I'd also like to welcome and thank our panelists for their expert testimony here today and for attending as we fight to protect the American people from the harmful effects of smoking, but more specifically, e-cigarettes and vaping. And I'd like to jump right into my line of questioning. Dr. Schuchat, according to your testimony, as of September 19, 2019, there were 530 confirmed cases of lung disease associated with e-cigarette use in 38 states and 1 territory. So far, at least 9 people have died as a result, and the overwhelming majority of these cases, 83% of which the CDC has complete data, are under the age of 35. These are young people. It's devastating that this disease has already taken 9 lives that we know of, and it's obvious tragedy. I've also seen reports, however, of individuals currently still on life support or on respirators for days on end. So, Dr. Schuchat, what do you know about the potential long-term health effects of this pulmonary illness associated with e-cigarettes?
We fear there may be long-term illness in a number of individuals. We're recommending individualized care for clinicians to follow patients after they're discharged and check pulmonary function tests and so forth. It's so new that the clinical course is probably variable, and some improvement is being noted in a number of individuals when they get steroid treatment. But, you know, the issue of long-term effects is very serious because these are young people who were pretty much fine and may have a life that's quite altered if they recover.
Is it possible that there are cases that we have missed prior to the outbreak?
Yes, we know there have been individual reports of serious lung injury following vaping or e-cigarette use in the past. We believe that something new is happening to cause these many cases that we're seeing now, and we know that the states and clinicians are really looking backward and getting all the cases reviewed that they can, but new cases continue to occur, and that's one of the reasons we feel this sense of urgency to get the public health messages out so that we can prevent further cases.
Dr. Schuchat and Dr. Sharpless, you've both said that no single product, device, or component has been identified as the specific cause of these illnesses, but you have reported at least some of the illnesses have been traced to street, unquote, products not sold by legitimate retailers. Dr. Sharpless, what authority does FDA have to take action against counterfeit or unregistered e-cigarette products?
So for counterfeit tobacco products, we have a range of authorities when we're able to identify them. This includes testing.
No. I mean the e-cigarettes.
Yeah, well, so for when the products involve THC, not a tobacco product, this is
generally speaking, e-cigarettes.
So e-cigarettes, as the FDA uses the term, are FDA-regulated tobacco product, and there we have the same authorities we have with other tobacco products.
Okay, and so you do have the ability to take action against this?
If it is a tobacco product, we have significant authorities, yes.
I'm sorry, you're parsing words here. We're here specifically about these e-cigarettes, right?
Right, I apologize for the lack of clarity. The FDA has significant authorities around tobacco products, including e-cigarette nicotine delivery. The nicotine is a tobacco-derived substance, so those products, we have great, strong authorities from the 2009 Tobacco Control Act as well as the deeming rule. THC and other, things that might be vaped that are not nicotine are jurisdictionally more challenging. A substance like THC that is a Schedule I drug is some shared regulation between the FDA and the DEA, which is why we have been working with them on those sorts of products.
Okay, Dr. Sharpless, to the extent that some of these products contributing to the illnesses may have been sold by registered retailers, what ability does the FDA have to order or recall or get these dangerous products off the shelves?
So when we can identify a manufacturer's source, we can send warning letters and use other measures, civil money penalties and that like, and even no tobacco sale order if we can identify a retailer that's selling a product that shouldn't be on the market.
And so have you already begun that process?
Early days in this investigation, as I said, we're right now our main focus is on testing the products, finding what they are and where they seem to come from, and then in many cases engaging.
But if people are losing their lives right now, wouldn't it be prudent to do a recall, to, a moratorium on sales, something that stops this until your testing is done?
Well, so that sounds a bit like a food outbreak, like what we would do if there were a bad food, but this is different in this way.
How is it different?
Well,
people are dying.
Many of these products are illicit, so people are not forthcoming.
Yeah, but you know what, you can do a process of elimination, right?
We have better authorities about the illicit products that are sold through legitimate retailers, but many of these products are not that.
Thank you very much, Madam Chair. I yield back.
Chair now recognizes the gentleman from New York, Mr. Tonko, for 5 minutes.
Thank you, Madam Chair, for the subcommittee hearing, and thank you to our witnesses for appearing before the subcommittee. The 2016 final deeming rule issued by FDA brought e-cigarettes within FDA's regulatory authority under the Tobacco Control Act. But FDA is not exercising that authority to its fullest extent, and e-cigarettes only remain on the market today due to FDA's enforcement discretion. As has been well established this morning, teen use of e-cigarettes has skyrocketed over the past several years. In fact, the youth use rate of e-cigarettes surpassed conventional cigarette use some 5 years ago. So Dr. Sharpless, can you explain why FDA decided in 2017 to extend the compliance deadlines for FDA review of the public health risks of these products?
Sure, as part of a broader comprehensive strategy regarding tobacco in general, the FDA at that time looked at the data, we're a science-driven organization, and concluded that e-cigarette use among children from 2015 to 2017 was going down or leveling off. That was before this explosion of youth use that we've now seen in the last 2 years. When the FDA began to appreciate that this sort of rocket was taking off and we needed to be more engaged, we stepped our enforcement education activities and now very broad policy activities that would have a major effect on the market.
Well, in retrospect, should the FDA have acted more urgently?
I believe in retrospect, we should have acted more urgently.
Okay, so if I understand you correctly, FDA decided to delay the compliance deadlines in 2017 because there was a brief decline in youth use rates in 2015, and there was a potential health benefit to some individual addicted adult smokers. So my question to you then is, now that we have a fuller understanding of the terrible epidemic that youth in this country are facing, have these considerations changed?
The FDA has always been very clear that as new facts emerge and we get new data, we will change our regulatory posture, and I would argue have done so, starting with the 2018 NYTS data, which was very concerning, and then the preliminary data we've seen from 2019 has really sounded the alarms further.
So if that's true, then how will FDA account for them in their eventual reviews of these products?
Right, so we have moved up the date for PMTA submission, these pre-market tobacco applications, so now to May 2020. So all products on the market today are illegal. To be legally marketed, they will have to come to the FDA and have a PMTA approved. In addition, our compliance policy that we announced, the President announced his support for recently, would have the effect of removing flavored products, which are particularly appealing to children, from the market very soon.
Well, Dr. Sharpless, we will hear on the second panel that Michigan has temporarily banned flavored products, while Massachusetts has banned all vaping products for 4 months. There seems to be the recognition that we have a public health epidemic requiring some urgency from our regulatory agencies. So why has it taken a multi-state outbreak of severe pulmonary illnesses and several deaths for this administration to take action to protect young people's health?
Congressman, I would say the major point of data that is driving our compliance policy is the Youth Tobacco Survey, the NYTS. So this epidemic of youth use that we've identified for multiple data sets, not just the NYTS, showing youth use. And that is, I think the sense of urgency is further injected by this other problem, the vaping lung injuries. But I think that the administration considers its duty to protect children a top priority and is really acting in response to the NYTS data.
Well, when FDA finally reviews these products, it must assess whether they are, and I quote, appropriate for the protection of public health. So, Dr. Sharpless, will FDA ban them if it ultimately determines that the dangers of youth use outweigh any potential benefits to adult smokers?
Certainly, we have issued guidances or a guidance to industry about what the information is to be included in a PMTA. I think we've been very clear, and we've already approved products through the PMTA process. And that's the sort of thing we consider is the benefit. The standard is what you mentioned. This product has to be good for the public health, and if it's not, it won't be authorized.
Well, I thank you for your responses. With all these new tobacco products flooding the market over the past few years, without a full understanding of the public health risks, it is not surprising that we're in such a crisis situation today. And I have to echo my concerns over and over again how this administration has rejected science in many formats and ways. And that is troublesome to me. So I would hope, again, that we approach this issue with all the science-based, evidence-based data at our fingertips, and those data speak to us boldly, and we should respond in public policy format so as to protect the lives of young people and all people across the board by sound policy. So with that, I yield back, Madam Chair.
Thank the gentleman. The ranking member and I now will just ask a few closing questions. Mr. Guthrie, recognized.
Thank you. Thanks, Chair, for doing second round real quick. And based on something I heard earlier, and I saw this yesterday, I think I saw it. I remember if I heard it or read it, but somebody says if this was lettuce, it'd be off the market tomorrow. And so if you want to look at the equivalent, if somebody bought tainted lettuce at a grocery store, you trace back to where that came from and you would shut that whole supply line down. But if somebody bought tainted lettuce at a corner food, or if you drive through Kentucky, people are on the side of the road selling their vegetables in the summertime, which is fantastic, get fresh vegetables. But if somebody's just out selling, you wouldn't go shut down all the supply line in the grocery stores because somebody bought tainted lettuce from somewhere that you can't trace, you can't figure exactly where it comes from. I think that would be more of the clue. I think if you could trace that, you would shut it down. My guess on that.
I agree with that characterization, Congressman Guthrie. I think the problem here is that we don't believe that the cases are being totally forthcoming with us in all instances of what they've been using, and they're not eager to identify what products have been using, and certainly the manufacturers are not eager to identify, to be known. In a food outbreak, the manufacturer has an interest in getting that food off the market. They don't want their product to get a bad reputation. But with an illicit substance, it's very different from a food
It's a lot easier when it comes to a corporate chain because you can trace it as opposed to somebody's farm that just sold it to somebody. It's hard to find. It's just harder to find that way.
Right.
So you said the National Youth Tobacco Survey is what you use to make some decisions. And I've noticed that it's increased greatly, but that information is relatively new. Is it, maybe it came out in September or so? So you are using it to react to. And I think what you said, given where we are now, we should have reacted 3 years ago. But you're reacting to it now that you know, you're knowing the information today.
Right. I think as new facts have emerged, the FDA has changed its posture. So, we're very clear that as we would continue to monitor the science and gather new data. The NYTS data from 2019 is still preliminary. We're working to get that data out with the CDC as quickly as possible. But I would say it's not the sole data source. So there's a study from NIDA, and there are these state studies that have been referenced. And the fact that there's a striking epidemic of youth use of e-cigarettes is, I think, non-controversial.
Absolutely.
It's been supported by many data sets.
Good. And then one final thing. I was going to ask this in my previous questions. I was talking about THC previously in my questions. So is the FDA involved in any federal investigation of vaping products containing THC? Or has the FDA declined to be involved in any federal investigation of vaping products with THC?
So we have engaged heavily with the DEA. So we've had numerous joint calls and set up communication between our chemists and their chemists, our enforcement people and their enforcement people, our cybercrimes people and their cybercrimes people. They have a number of ongoing investigations related to THC vaping products, and they're sharing data on those with us. Our question is, where are these products coming from, and are they adulterated and of that nature? So I think there's good cooperation between the federal agencies related to THC.
Okay, I don't want to use all my time, but I'll finish with this. I was in your mail facility, our mail facility as Americans at JFK Airport, and your FDA group was there. It's amazing the things they are finding illicit. They were showing different tablets that were that we would consider brand name drugs today, and how they copied the logos. Sometimes the logos are off center and things like that. So we do, it's just, when you stand there and see the volume that your brave people there going through, some dealing with fentanyl where they have to wear protective gear to find what's going through. They're working, but it is an enormous task. We ask a lot of them, but we appreciate the effort that you guys do in this, and what the CDC is doing as well, and just all the work that you guys are doing.
Thank you, Congressman. I might say that's a real pride of the FDA, the IMFs, and have substantially increased their capacity thanks to the generous support of Congress in recent years.
Thank you very much. I appreciate that, and I yield back.
Thank the gentleman. Dr. Sharpless, I just want to clarify how this compliance policy of the FDA on the flavors is going to work, which is, as I understand it, the same way it would work under the legislation that I've introduced. And that is, you send out your order, then the companies are required to withdraw the flavored products. And then they can come and make an application with the FDA to try to show why they think that it's safe to market them. Is that right?
That's correct. Upon finalization, the guidance would then go into effect some period later. We would send out warning letters and other sorts of enforcement activity to pull flavor for the products from the market. Anyone who thought that their product was good for the public health, that could meet the standard, can file a PMTA application at any time, before May 2020, but at least by May 2020. And if the product can demonstrate public health use, then it would be authorized for sale.
And what would the criteria that would be used to allow that to happen?
So the PMTA application, we've provided extensive guidance about what we expect industry to include on those. It's things like, how is it manufactured, what are its components, nicotine levels, appeal to children and use by specific populations, risks for addiction and diversion, so things like that.
But the reason why you're withdrawing it now is because there's substantial evidence that these flavors are appealing to teenagers and youth and getting them hooked on nicotine. Is that right?
That's correct. The data suggests that kids really like flavors. Nicotine is somewhat harsh, straight, and so flavors can mask that and make it more appealing to new users.
So that's the evidence that would be used to counterweight any of the
Right. I
arguments.
think the evidence that's emerged from the NYTS studies and other studies is very strong that flavors drive childhood use.
Okay. So I got to say, I haven't heard anything today to show why these products should be marketed. There's some anecdotal evidence that maybe it can help some existing adult smokers not smoke cigarettes, but other than that, I haven't heard any reason why we shouldn't ban these flavors, why we shouldn't ban kids from being able to get these, and why we shouldn't aggressively pursue this from a public health perspective. But I think there has been some confusing questioning to both of our witnesses today, implying maybe it's just illicit drugs, or maybe it's just off-market vaping devices or whatever. So you guys have the forum right now. I would like to ask each one of you to tell us, what is your message to the parents of America regarding whether their kids should be using any form of e-cigarettes? Dr. Schuckett, we can start with you.
We want parents to talk to their kids. They should not be using these products, e-cigarettes with nicotine or vaping products with other substances. We're very concerned. We have tip sheets for parents on how to talk to their kids about this. These are dangerous products for youth.
Dr. Sharpless.
I think our message largely agrees. We think that these products are unsafe for children, whether they contain THC or nicotine, and would not recommend their use. We really don't think anyone should be using e-cigarettes except for perhaps the person who's using it instead of a combustible cigarette, because combustible cigarettes are really bad and we want to minimize their use as well.
Thank you. I want to thank both of our witnesses for participating today. You know the drill. Members will submit questions for the record, and I would ask each of the witnesses to agree to respond promptly to any of those questions should you receive any. With that, the subcommittee will dismiss panel one, and after the second panel has been set, we will invite our witnesses to come. Thanks to both of you for coming today.
Mic is on when that light is on.
I'm now delighted to introduce our second panel of witnesses for today's hearing, Dr. John A. Khaldun, who's a Chief Deputy Director for Health and Chief Medical Executive, Michigan Department of Health and Human Services, Dr. Elizabeth Cuervo-Tilson, State Health Director and Chief Medical Officer of North Carolina Department of Health and Human Services, Dr. Lee Norman, Secretary of the Kansas Department of Health and Environment, and Dr. Monica Burrell. And Dr. Burrell is the Commissioner of the Massachusetts Department of Public Health. I want to thank all of you for appearing before the committee today. Now, you're aware the committee is holding an investigative hearing, and when we do so, we have the practice of taking our testimony under oath. Do you have any objections to testifying under oath today? No. Let the record reflect the witnesses have responded no. The chair then advises you that under the rules of the House and the rules of the committee, you're entitled to be accompanied by counsel. Do any of you request to be accompanied by counsel today? No. Let the record reflect that the witnesses have stated no. If you would then, please rise and raise your right hand so you may be sworn in. Do you swear the testimony that you're about to give is the truth, the whole truth, and nothing but the truth? Let the record reflect the witnesses have responded in the affirmative, and you're already seated. You're now under oath and subject to the penalty set forth in Title 18, Section 1001 of the United States Code. The chair will now recognize our witnesses for a 5-minute summary of their written statement. In front of you is the microphone and a series of lights. The light will turn yellow when you have a minute left and red to indicate when your time has come to an end. And so let me please start with you, Dr. Khaldun. Welcome, and you're recognized for 5 minutes.
Chair DeGette, Ranking Member Guthrie, and members of the subcommittee, thank you for the opportunity to speak with you today regarding the public health crisis of youth e-cigarette use. As the mother of 3 children, a practicing emergency medicine physician, and a state public health official, there's nothing more astounding than the fact that we have let an entire new generation of youth start using nicotine products. As a society, we let these e-cigarettes sneak onto the market without proper oversight or understanding of their health impacts. We can no longer stand idly by while this public health crisis ravages our communities. Nationwide, e-cigarette use among middle and high school students increased 900% between 2011 and 2015. The total number of children who are currently using e-cigarettes rose to an astonishing 3.6 million in 2018, 1.5 million more than the previous year. In some counties in Michigan, more than 1/3 of high school students are using e-cigarettes. This epidemic can be attributed in large part to the appeal of flavored vapor products to youth, as well as the advertising and promotional activities by companies that glamorize the use of nicotine products nationwide. Flavors such as strawberry milk, banana split, cotton candy, and gummy bear clearly target children, and advertisements for vaping products are often visually appealing to children with pictures of candy on the packaging. Studies show that flavors are a major reason that youth start vaping, and even scarier, many young people use these products without understanding their contents or the fact that they have nicotine in them. I recently spoke with the parent of one of my children's friends who was devastated that they found these products in their child's bedroom, and they're now desperately trying to find resources for support for their child's addiction. Earlier this month, under the leadership of Governor Gretchen Whitmer, Michigan became the first state to announce a ban on the sale of all flavored nicotine vaping products. Our emergency rules also ban fraudulent or misleading advertising and disallow marketing of these products at the point of sale. This strong leadership is necessary given the significant toll this epidemic has taken on our society, and particularly our youth, and I'm pleased that other states are taking similar action. In addition to this public health crisis of youth e-cigarette use, as of September 20th, we had 530 confirmed or probable cases of vaping-associated lung injury across the country and 9 deaths. In Michigan, we know of 15 confirmed or probable cases of this illness and are investigating several more. During our investigation into these vaping illnesses, it's been heartbreaking to speak to families of young people who were otherwise healthy and are now barely clinging to life. There are key things we must do to fight this epidemic. First, We need strong regulatory oversight over e-cigarettes. E-cigarettes should not be allowed on the market unless they are proven to be safe, and companies selling these products should not be allowed to market to youth or fraudulently market their products as safe. Second, more research is needed to understand the long-term health effects of e-cigarette use. Assertions that e-cigarette use is effective for smoking cessation are not scientifically proven, and the FDA has not approved e-cigarettes as part of a smoking cessation program. E-cigarettes also can contain cancer-causing toxins. We need to make sure we fully understand the health impacts of these products before we allow them to be on the market. And finally, we need to make sure there is sustained and increased funding for tobacco prevention education, as well as funding for tobacco cessation efforts for youth and adults. Prevention efforts are a critical part of putting an end to this epidemic. The data around the epidemic of youth vaping is very clear, and we must do more to properly regulate these products so no one, youth or adult, is harmed. Thank you for allowing me to participate in this subcommittee hearing today, and I look forward to working with you.
Thank you, Doctor. Dr. Tilson, you're now recognized for 5 minutes.
Chairman Pallone, Chair DeGette, Ranking Member Guthrie, and members of the subcommittee, thank you for the opportunity to testify today on the public health threats that e-cigarettes pose to our youth. My name is Dr. Elizabeth Cuervo Tilson, and I serve as the State Health Director and Chief Medical Officer for the North Carolina Department of Health and Human Services. As you know, in December of 2018, the U.S. Surgeon General called e-cigarette use among youth an epidemic. As a public health official, a pediatrician, and a preventive medicine physician, I see this epidemic playing out across our schools and our communities in North Carolina. Our most recent North Carolina youth tobacco survey found that although combustible cigarette smoking was at a lowest ever recorded amongst high school students at 8.9%, e-cigarette use increased 894% since 2011. E-cigarettes have become the most commonly used tobacco product amongst youth in North Carolina, and further concerns have now risen with the multi-state investigation of severe lung illness associated with e-cigarettes and vaping. But before I go on, let me put a face onto this epidemic. Luca is a teenager from High Point, North Carolina. As a high school freshman, Luca started using Juul as a way to fit in with his upperclassmen on football Friday nights. He quickly became addicted to the nicotine in the product, even to the point of selling his clothes and other items to raise the $150 a week he needed to support his nicotine addiction. Once a Boy Scout, an athlete, and an A student, Luca let his grades fall and dropped out of extracurricular activities. Usually a well-behaved 15-year-old, Luca became irritable and angry, even throwing violent outbursts of rage. Finally, a nicotine-related seizure ended him up in the emergency department. At that point, Luca and his parents knew they had to do everything they could to get Luca the treatment he needed for his nicotine addiction. Luca participated in a nearly 40-day substance use treatment program in California twice. Thankfully, he is now living substance-free, but Luca is not alone, and we've heard similar stories from across our state and our nation, and we must act to protect our children. And let me be clear, e-cigarettes are not safe. Nicotine is the major psychoactive substance found in e-cigarette solutions and is highly addictive. Youth and young adults are particularly at risk for the long-term effects due to the exposure of a nicotine on their developing brain. Nicotine is related to seizures, nicotine can cause harm to developing fetus, and there's emerging data that nicotine use through e-cigarettes may increase the risk of emphysema, or a form of long-term lung disease. Further, as the acute outbreak of severe lung illness associated with e-cigarette products, 36 cases have been reported in North Carolina, almost all requiring hospitalizations, more than half requiring intensive care. Thankfully, we've had no deaths to date in North Carolina, and currently we have not identified the exact cause of this illness in our state. Some key factors identified that may be driving e-cigarette use among our youth include marketing strategies that appeal to youth, the delivery systems like the USB-like systems that are easy to conceal, used discreetly and not recognized as adults as e-cigarettes, the use of flavors that attract youth to the products, and then the highly addictive nicotine which keeps them coming back. Youth use of e-cigarettes has challenged the resources of our state to address. Despite our 100% tobacco-free school policy, our school staff are finding e-cigarettes on school grounds, report that students' e-cigarette use is problematic, contributing to learning disruptions, and do not think they have the resources to sufficiently address this new wave of tobacco products. We have insufficient resources to do evidence-based mass health promotion and media campaigns to compete with the e-cigarette and vaping messages. Our Quit line, which is our telephone and web-based tobacco treatment program is only resourced to serve about 1/8 of the number of our state tobacco users recommended by CDC best practices. And our local health departments are not structured or resourced to sustain a long-term response to this new outbreak. The e-cigarette epidemic among youth and young adults is a public health threat that will not be solved by one strategy, one policy, or a single federal agency or state. We'll need a comprehensive approach and utilize best practices and lessons learned from our success in combustible tobacco. Federal and state policies to consider include curbing advertising and marketing to youth, limiting youth access to e-cigarettes in retail and internet settings, reducing access to flavored tobacco products by youth, implementing price policies, and adding e-cigarettes to smoke-free indoor air policies. Increased funding should be allocated to further adopt and expand on CDC-recommended evidence-based state and local tobacco use prevention and cessation interventions, including community interventions, mass reach health communications and mass media, evidence-based treatment and cessation interventions, surveillance and intervention, infrastructure, administration, and management. Thank you for the opportunity to share some of our experience with you, and I applaud the subcommittee's work to help address this urgent public health issue.
Thank you, Dr. Tilson. Thank you for putting a human face on this, too. Dr. Norman, you're now recognized for 5 minutes.
Good afternoon, Chair DeGette, Ranking Member Guthrie, and subcommittee members, and thank you for the opportunity to speak with you today. My name is Dr. Lee Norman, and I am the Kansas Secretary of the Department of Health and Environment. I'm also the state health official, and I'm an Army Lieutenant Colonel and the Army State Surgeon of Kansas. I want to first give you a brief update as what we're seeing in Kansas. We now have 10 hospitalizations confirmed from vaping and e-cigarette related and illnesses, including 2 deaths in adults. That's an increase over the numbers that were quoted by the CDC from last week, and that was just a new adult added this week to that list. We have the same vaping patterns as seen around the country with these lung diseases and illnesses from the vaping solutions. Some have been nicotine only, some have been THC only, and some have been a combination of both, including CBD oil. The final analysis is pending the return of the test results from the FDA, and what I just told you was of what we took by way of history from the deceased family members. Similar demographics as U.S. vaping patterns. 2/3 are an 18 to 34-year-old in Kansas. 16% are under the age of 18. 17% of users are under age 35, and 3/4 of the users are male. In Kansas and nationwide, over 1/2 of all e-cigarette users also smoke combustible cigarettes, while, of note, 80% of use first contact with nicotine is through vaping. What we are doing in Kansas, similar to my colleagues, intensive public health information campaign. We're working closely with the Department of Education on school programs for vape-free toolkits, intensive medical professional education and alerts. We're working with the FDA and CDC, of course, and our local municipalities to incorporate e-cigarettes into the State Indoor Clean Air Act. I want to comment briefly on the military, because there's an ominous trend going on in smoking and e-cigarette use in the military. The military in aggregate right now is at its lowest rate of combustible cigarette use in modern history. But the new trend line, especially due to vaping, shows it to be on the rise. Now, alarmingly, e-cigarette users outnumber combustible cigarette smokers in military service members. In my 2017 to 2018 deployment in the Middle East, I saw vaping-related lung injury firsthand. This is an emerging military health protection issue. The hard-earned anti-tobacco gains are being quickly swept away by vaping and e-cigarettes. We need help at the state level. Regulating marketing, the flavors attract the youth, no question about it. 96% of the youth who end up using tobacco started with flavored products. Joe Camel and the Marlboro Man taught us valuable lessons about the effectiveness of marketing to youth. We must together counter the effective industry marketing efforts. We must regulate sales. We shouldn't sell tobacco products to those less than 21 years of age. No internet sales of nicotine products. Regulating contents of vaping and e-cigarette products is important. There is no consistent labeling of the products. There should be. We don't know what the offending substances are. We need to know what those are. We need time for the science to catch up with the epidemic of illnesses and death. We need to broaden the anti-smoking laws to include e-cigarettes. We need to support tobacco control and prevention funding. In summary, e-cigarettes are wildly efficient nicotine delivery systems designed to expose and addict youth to nicotine. Currently approved smoking cessation methods are not approved for those under 18. We must prevent addiction to nicotine. Vaping is effectively showing them the way to nicotine use and addiction. The U.S. Preventive Services Task Force and other professional research organizations say, quote, insufficient evidence to support e-cigarettes as an effective tobacco cessation intervention. Other proven methods of cessation do exist. Given that we don't fully know the health effects of vaping solutions, or oftentimes even the contents, we must apply consumer protection fundamentals to protect our citizens, much as we would tainted meats or malfunctioning automobile airbags. I will welcome your questions, of course, later, and thank you very much for this opportunity.
Thank you, Dr. Norman. And now, Dr. Burrell, I'm pleased to recognize you for 5 minutes.
Thank you very much. Good afternoon, Chair Dingell, Ranking Member Guthrie, and members of the subcommittee. Thank you for the opportunity to provide testimony on this pressing issue today. As the Massachusetts Commissioner of Public Health, as a physician, and as a community member, I am extremely concerned about vaping, especially among our youth. So thank you I commend you for shining a light on this crisis today. I'd like to take a few minutes to share with you today what we are seeing and what we are doing about this critical public health issue in Massachusetts. I'm proud that Massachusetts has a long history of being at the forefront of public health, and with the current vaping epidemic, we're continuing to be proactive in our response based on evidence-based tobacco cessation and education programming. Last year, Massachusetts raised the minimum age to purchase tobacco products, including e-cigarettes, to 21. We also prohibited vaping where it's illegal to smoke, and became the first state in the nation to ban the sale of all tobacco products in pharmacies. Massachusetts has made significant progress in curbing both youth and adult tobacco use over the last few decades. Look back to 1996, our youth smoking rate in 1996 was 38%. Now that rate today is 6.4%. And our adult smoking rate is one of the lowest in the nation at less than 14%. The cornerstone of our work has always been prevention. We have a strong cessation and prevention infrastructure and a network of community partners and dedicated advocates to help educate our communities on what we know. Unfortunately, this progress is now at risk. The industries are using the same old techniques to bring new products, cheap, sweet, and attractive to youth. And it's working in Massachusetts and across the country. We hear time and time again horror stories from children who are talking about the vaping in their bathrooms at school, who are too short of breath to participate in their sports activities, and children 11 and 12 years old who have to sleep with these devices underneath their pillows because they're so addicted they're waking up in the middle of the night to use them. We know that in Massachusetts, from our 2017 data, that 40% of high schoolers have tried these products, and 1 in 5, 20%, are using them regularly. And now we're confronted with the emergence of this serious vaping-related lung disease being seen across the country. 2 weeks ago, I exercised my authority as Public Health Commissioner to mandate that physicians immediately begin reporting any unexplained vaping-associated pulmonary disease to us at the Department of Public Health. We immediately started to hear about cases, 10 cases or more a day as we begin to ask for this reporting. We are now looking at 66 reported cases to us and have already reported to the CDC 3 confirmed cases and 2 probable ones. What this tells me and what I'm afraid of is that this is just the tip of the iceberg in what we will see related to these e-cigarettes. We don't know what is causing these illnesses yet, but we want to act now to protect our children. And yesterday in Massachusetts, we took a landmark step. Our governor, Governor Charlie Baker, declared a public health emergency in the Commonwealth and put in place an immediate 4-month ban on the sale of all vaping products, both nicotine and THC, both in retail and online. This ban on vaping product sales will enable our state to take a much-needed pause, and gather more information and data to inform our next steps to protect our public's health. We can't stand by and watch the industry hook another generation on these deadly products. It's up to us to confront the facts, sound the alarm, and protect public health, particularly in our youth. Our goal is simple. We do not want another generation of children to become addicted to nicotine. Thank you for commitment to your issue, and I look forward to working with you. Thank you.
Thank you so much, Doctor, and thanks to the entire panel. The Chair will now recognize herself for 5 minutes for questioning. Last year, the Surgeon General declared the youth use of e-cigarettes as an epidemic. Now, you're from all around the country. I would guess you probably would agree with the Surgeon General. I think you can all answer. Dr. Khaldun?
Yes, I would agree.
Dr. Tilson?
Yes, ma'am.
Dr. Norman?
Agree.
Dr. Burrell?
Agree.
Dr. Norman, you said in your testimony, in your written testimony, our youth were poised to be the generation that ended smoking. That legacy is now in jeopardy. What do you think needs to be done to reverse this tide and end the epidemic?
Was that question?
Dr. Norman.
Well, number one is that we are focusing today mostly on youth use of e-cigarettes. But one of the things that I think we cannot lose sight of is that these are so addictive. We have to also think about smoking in general, because this is an on-ramp to the use of combustible cigarettes.
That's right. Now, so you might have heard me say to the previous panel, I've sponsored legislation to increase the age to 21 for all of these products. And I've been, I was telling Mr. Guthrie that that it's a bipartisan bill. We have bipartisan sponsorship, and in the Senate Majority Leader, Mr. McConnell, has a companion bill. But nonetheless, as I've been talking to people on both sides of the aisle and trying to get co-sponsorship for my bill, people are reticent to co-sponsor my bill because they say that if somebody is serving in the military, they should be able to smoke, and people over 18 can serve in the military. When I was listening to your testimony, Dr. Norman, I thought you would be the perfect person to give the answer to that. So what's the answer to that?
I don't think we should allow smoking anywhere, but that's a public health expert talking.
Right.
The military has a long history of even supporting smoking, to be honest, way back to the days when it was in C rations. And they're available, nicotine in all products is available in very low cost. And I think that we need to accelerate the smoking cessation.
Do you think that's a good idea that we're making that available to the military?
No, I don't, there's nothing that would support that from a public health perspective.
And you said you think it's a good idea to raise the smoking age to 21. Do you think that even includes the military?
Yes, ma'am.
And that's because of the risk to public health, is that right?
Yes.
Now, so I want to ask each of you, I guess starting with you, Dr. Khaldun, what do you think the federal government could be doing more to protect children from e-cigarettes?
I think we really need to make sure that we don't allow this fraudulent marketing, this marketing to children saying that these products are safe. I think we need more evidence and data that they're actually, one, safe, and two, even effective for smoking cessation, because that is not scientifically proven.
Okay, thank you.
So that is what I believe.
Yeah, that's important. Dr. Tilson?
Yes, ma'am. As I mentioned in my comments, I think that we need to think about a comprehensive approach to tobacco control, same like we did with combustibles. So combinations of a policy around marketing, around regulation, around limiting access to to youth around price policies, as well as we need to increase resources for states to be able to implement CDC's best practice recommendations for prevention and cessation.
Dr. Norman?
I think it hovers a lot around marketing. I think we need to make it less appealing. I think we need to regulate the availability to an older population, and I think that we need to control what's the labeling of the product so people know what is actually in there.
Dr. Burrell?
When we passed Tobacco 21 in Massachusetts last year, it was based on the science of the developing brain. So whether someone can serve in the military at age 18 is a different question than whether or not someone should be using a tobacco product, because the brain continues to develop up to age 25, and we know that there can be damage to that, and that's how we support tobacco being raised to 21 for all.
Oh, go ahead.
And I was just going to add that I support what the other panelists said around restriction of flavors, also restriction of nicotine content, and ad restrictions.
And I just want to ask you one more question. You said that after you used your authority to require reporting, reports skyrocket. Do you think that's going to happen in other states around the country as we get more and more reporting?
Yes, I do, and I think the reason for that is several. One is that clinicians have not been asking about vaping. Teens have not been disclosing the use of these products. So as we increase awareness and we begin to ask and come forward, we'll see those cases. And also there seems to be something going on in this current environment. And that's why I said I'm worried that this is the tip of the iceberg, and we'll see more, not just acute things, but chronic conditions as well.
Thank you very much. And I'm now pleased to recognize the ranking member, Mr. Guthrie, for 5 minutes.
Thank you very much. I'm not here going to argue on the military. I agree, people 18 should not be smoking, but the principle kind of is, if somebody's going to be old enough to wear the uniform, are they not old enough to make other decisions about that? And I think it's debatable. I'm open to looking at it, at your bill as well. And also, I was mentioned, I won't say who mentioned it, but mentioned that I was talking a lot about THC here, but it seems like there's a big move to ban nicotine, which we need to prevent nicotine, but there's other states all across the country and whatever giving more opportunities. I know they're not focusing on young people, but if you give opportunities for people to have access to marijuana, it's going to get into the hands of younger people. And glad to see that you banned, Dr. Burrell, all forms of vaping, even THC. But I have a question, and for all the witnesses, but Dr. Norman, you kind of answered this in your statement, so you don't really have to, so you answered it. But your state, you've reported cases of vaping associated with pulmonary illness. And for each of you, how many cases have been reported in your state? And can you provide a breakdown of how many of those cases involved nicotine, THC, or both? And if it had THC, did it also have E-acetate?
Yes, so we in Michigan have had over 44 cases that have been reported to the health department. 15 of those are confirmed or probable cases. We have seen a mix, and again, this is family members or patients who are self-reporting, so we have some questions about what the actual truth may be, but this is self-reported. It's been THC, it's been nicotine, it's been both for some of them, so we don't, again, know what the exact substance is. Okay. We have not, in Michigan, we don't test the products ourselves. We send it to the FDA lab for testing, and so at this point, we do not know what other substances may be involved.
Okay.
Yes, sir, I'll share some of the data we have from North Carolina. So we have 36 cases reported so far. We're in the midst of investigating those cases. So for the 27 that we have the medical record information from, 75% of them have reported THC use, 17% have reported CBD, 45% have reported nicotine and flavors, and 37% have reported both THC and nicotine. Of the 16 that we've had the actual interviews for, 94% have revealed use of THC, and 56% have reported vaping nicotine. And we have been doing testing in our state lab, as well as sending our samples to the FDA. We don't have our FDA reports back, same as the other states, but of what we found in our lab, of the 41 that we have results from, 71% have had evidence of THC, half have had evidence of vitamin E, so only half and the other half haven't, as well as we've found terpenes, nicotine, menthol, and glycerol as well in some of the other samples. So a mixed bag of different findings.
You've already kind of talked about that, Dr. Norman. Deborah?
We've had, in Massachusetts, we've had 66 cases that have been reported to us. 3 have been confirmed by the CDC definition and 2 probable. The rest are currently under investigation. However, we do know that so far the majority of them are under the age of 30 in terms of the suspects. And we also know that it is a mix. Some are THC only, some are nicotine only, and some are both THC and nicotine.
And you know if there are other oils? Do you know if there are other oils in
No, we're not doing our investigation of the actual materials. This is survey-based from both clinicians and individuals, so we aren't doing the actual testing in our lab.
Okay. Well, thanks a lot. And all of you said that you're using the FDA, you're waiting on FDA results. How long does it take to get the results from the FDA? And has the FDA told your state about the information they will share about your state's results and how your results compare to the overall results they uncover?
In Michigan, I'm actually not aware of how long it will take the FDA to get those results back to us. We do have regular communications with the FDA and the CDC, but I'm not aware of how long it will take to get those results back.
Okay.
Yes, sir, and I think this is a relatively new outbreak.
Are you starting to get results back? I guess, have you got some results back so you know how long it's taken? You're still waiting for, okay.
I'm still waiting.
Okay.
Yeah, we have not gotten specific results back, but we have gotten communication from the FDA talking about what they have been finding, and again, haven't been finding one specific additive, have been telling us they've been finding a broad range of additives. Not one substance seems to be identified, so we've been getting qualitative reports back from the FDA, but not the specific quantitative reports back.
Okay, thank you. Dr. Norman?
Our first sample was sent in mid-August, and we haven't received any of the results back yet.
Oh, okay.
Our information at this point is qualitative as well.
Okay, well, thanks. Getting back on the other, if you do just a search on the web, matter of fact, Chair DeGette was showing me a picture of a hoodie that actually the cord of the hoodie is a vaping device. It just seems there's a lot of, I don't know if that's illegal, I don't know if that was an illicit side or where you can move forward, but obviously he's marketing towards children, it appears, unless somebody who's an adult wants to do it at work and nobody knows they're doing it. Otherwise, people that I know that going from cigarettes to vaping don't hide that they're vaping because they didn't hide that they were smoking, so moving forward. So there are a lot of illicit products, I'd say, more, and I'm out of time, so I'll turn it over to my friend from Massachusetts, but I was gonna say, what are your states are doing to move forward? But I will yield back to my friend.
The acting chair, thanks, gentlemen. And recognizes the gentlelady from Illinois, Ms. Schakowsky, for 5 minutes.
Thank you. On August 23rd of this year, we learned that an Illinois resident died from the current outbreak of lung illness linked to e-cigarettes. The death is tragic, but the more I listen to what's the testimony I've heard today, it also seems to be preventable. And Dr. Norman, your state has also suffered 2 deaths in recent weeks due to this illness. Do you believe, and anyone else can weigh in on this, do you believe that we could have prevented these deaths in this outbreak if the FDA had not delayed the Obama administration final rule that would have started e-cigarette regulation in 2018, and then that was postponed by this current administration?
And who was that question posed to?
And you, but
Okay.
anyone who wants to answer.
Well,
as well.
We've been doing public health messaging for a long time, and I really feel that in the state of Kansas, people and the potential users and users know it is not healthy to vape or to use e-cigarettes. So it's not out of lack of knowledge that people are starting and using e-cigarettes. And I do believe that whatever regulations can be propagated that would push towards restriction and less easy access to products and unregulated products, I think that's where the Holy Grail is.
So as my question was that actually it could have started in 2018, would that have been effective? Regulation could have started. Wondered if anyone else wanted to weigh in. Yes, Doctor.
I mean, we saw across the country a 900% increase in students who are using vaping products between 2011 and 2015, so it started a little bit earlier. I do know that there are youth in the state of Michigan who don't even know what's in these products. They've been marketed to, so it is a possibility that could have potentially prevented some of this, but I don't think we know for sure. Again, we don't know what the exact cause of these vaping-related illnesses are.
So we heard from Dr. Shugat that not the accelerator, what do you call the what? Yeah, the aerosol has toxic chemicals in it, that we apparently know that. So are we aware of everything that's in these? Have we done good research to know even how things like the aerosol could affect the health? Anybody? Do we know?
We learned last week on an FDA call that we have more information about what is in the vaping solution that goes in that end of the e-cigarette than what comes out in the aerosol, because there's certainly are changed by the process of the vaping.
So were you all here for the last panel? Yes. Okay.
Yes.
Yes. So did you hear enough in terms of what is being done? Do you feel satisfied that going forward that we're going to make progress as fast as we could, as effectively as we could, from what you heard both from the FDA and the CDC? Let's start at that end.
I think it's a complex investigation. I'm pleased that the FDA and CDC are providing support to our state and local governments. But I think collectively as a society, we probably could have done more sooner. But I am pleased that the CDC and FDA are looking at this closely.
Okay.
I would agree. I'm pleased with the proactive approach CDC and FDA is taking, but I think we all acknowledge, and I think the prior panel acknowledged, there's a lot more that we need to do, and this is really an urgent public health crisis that we need to do a lot more, and we need to do it quickly.
Okay.
Agree.
Okay.
What I know is that we are seeing an alarming increase, as you mentioned earlier, in these vaping-associated pulmonary diseases. And in Massachusetts, we put the temporary ban of all vaping products in place in order to take a pause, prevent further illness and death from this lung-associated disease, and be able to gather more data and information because there is so much that's unknown.
So we're going to see an increase in the number of people that are addicted to nicotine right now. Is this something that is going to be alleviated even at this point? Are we going to see this increase going on as we go forward? Just yes or no?
Yes, we do currently have youth who are addicted to nicotine, and we need to help them address their addiction.
Yes, and we need a comprehensive, full steam ahead approach to address this.
Yes, I think we're going to see a marked uptick.
Nicotine is highly addictive to youth in the way it's currently being marketed with flavors and access. We're going to see the problem continue to get worse.
Thank you. I yield back.
Thank you. Chair now yields to Mr. Griffith from Virginia. 5 minutes.
Thank you very much, Madam Chair. I appreciate all of y'all being here today. The information is very important to us. Dr. Tilson and Dr. Norman, because marijuana is not legalized in your states, do you believe youth are accurately reporting their use of products containing THC when they become sick?
Well, it's always hard to know exactly if people are being completely accurate. However, in both our medical records and our interviews, people are reporting that they are using THC up to 75%. So it's hard to know that everybody's reporting accurately, but a large percentage are reporting.
And same question to you, Dr. Norman.
I feel pretty certain that we don't always get the straight story, and that's why we really do need to know the chemical analysis. I don't think that people are always honest with their medical history taking.
Yeah. And are there, I understand the chemical analysis, but are there any other alternatives that you might use to increase the accuracy of the reporting? Either of you.
Well, we are testing their devices and what the solution is in the devices. So it's a combination of medical reports, interview, and then the testing of the actual liquid in the devices that we're using.
Yeah, I think that's the key piece that's missing. Our medical evaluations are pretty straightforward. The clinical care that's being provided is well understood. Our data gathering that we forward along to the CDC and the FDA is, I think, traditional what we do in medicine and in public health, but we do need more of the analytics.
And just curious, because I know when we're doing polling data, we ask the same question sometimes in 2 or 3 different ways so that we're trying to elicit a more accurate response. Do you all do that for this information as well? Figure out different ways to ask something similar so that you can elicit a better response. Go ahead, Dr. Tilson.
Well, we're using the CDC reporting, making sure we're reporting the data elements of CDC so we can have a consistent reporting of different elements across the state. And that our interviewers are pretty experienced in doing interviews with patients. So it is hard to know exactly that they're 100% accurate, but our interviewers are pretty experienced in doing interviews with people.
I'll take that as a yes. You're doing some interesting things, but each interviewer does it with their own style. You know, we talked about street products and so forth. In knowing that street products are contributing to the outbreak, what are your state's enforcement authorities and jurisdictions doing to crack down on the illicit street products that aren't from your commercial sellers? And anybody can answer that.
Yeah, so a couple. So one, within North Carolina, tobacco sales are not licensed. So it's a little bit hard for us to really use that licensing data and to track within our license. And then with our illicit and unlicensed dealers and vendors, as was talked about earlier in this panel, it's hard to track those down. The investigation authority sits within our State Bureau of Investigation, or our alcohol and law enforcement. So we've been starting to have conversations with them. If there was a complaint or us to be able to figure a signal, looks like it's coming from this geographic area or this store, then they can then go and then investigate that complaint. But right now we don't have enough localizing data to really direct them.
Let me ask this, and I'm going to start with you. And I'm sorry I was not here earlier. I was in another hearing. Dr. Burrell, did I
Yes,
get that
that's
right? Okay, thank you. I apologize.
No problem.
Do you all have a possession, is it illegal to possess a vaping device under the age of 18 in your state?
No, so the temporary ban that we put in place yesterday is around the sale. So
Okay.
the temporary ban for 4 months is
Do any of you have a possession statute?
Yes, in the state of Michigan, in June, we actually passed a law and updated the Youth Tobacco Act. So now it prohibits a minor from possessing or using a vapor or alternative nicotine product.
All right, I appreciate that. Let me ask Dr. Norman, you raised an issue earlier when you were talking about the FDA and their testing what's going in, but you don't know if they're testing what's coming out. Is that correct?
That's what we heard on the call with the FDA last week.
And you think it'd be important, and I would agree with that, but I don't want to put words in your mouth, that we test the smoke that's coming out as well, because the processes, while the vaping is taking place, could actually change some of those chemicals, and it could be the...
I'm not an expert on the engineering that goes into the vaping devices, and there's many different ones. But I think there's plenty of reason to believe that the ingredients that go in are not necessarily identical to the ingredients that come out.
And so the lung problems could actually be either or both. What's in it to begin with, what's coming out as the smoke, or a combination of the two. Is that correct?
I don't know. I mean, I really don't know the answer to that until we
It's
find
a reasonable
out.
guess, though.
A
That
reasonable guess
some
would be-
combination thereof, and we need to know all the answers, not just half of them. Is that what you're saying?
Yes.
I appreciate it very much. I yield back.
Thank the gentleman. Chair now recognizes the gentleman from Massachusetts for 5 minutes.
Thank you, Madam Chair. Thank you to our witnesses. Thank you for your patience and your extensive testimony today. Dr. Burrell, wonderful to see you again. Thank you for your leadership at the helm of our healthcare system in Massachusetts. Grateful that you're here. Yesterday, our Governor Charlie Baker, declared a public health emergency and implemented an immediate ban on the sale of vaping products in Massachusetts. As patients sit in hospital rooms with a mysterious vaping-related illness, and now businesses across our Commonwealth shutter, this has clearly been, at least in my mind, a catastrophic regulatory failure. Dr. Burrell, to start with you, what should the FDA be doing immediately to support state efforts to contain this outbreak?
So there are several things that our federal partners could do. We could look at, in Massachusetts, we went to Tobacco 21. That would decrease access for young people. Flavor restrictions would also decrease access, as well as understanding what is the content of these products, just like we do with tobacco products, and testing the nicotine levels, as well as allowing us to limit advertising and put warnings on the products as well as in stores.
And I wanted to see if you can clarify and walk me through this a bit, any of the witnesses here. Looking at the acting commissioner's testimony, he said that, quote, no ends product in the United States is on the market legally. For somebody that doesn't quite understand perhaps the term of art there, it certainly seems like there is a legal market for these products, is there not?
Doctor?
And I can't speak to that specific thing. What I do understand is that there are FDA-approved nicotine replacement therapies available. And as a clinician, that is what I would advise individuals to use, the FDA-approved, such as the patches, the gums, and the lozenges. And
Do you think the public is aware that there's some of these products that do not actually have FDA approval that are on the market?
I think that part of our education has to be around what approved cessation tools they are. And actually, as part of our temporary ban in Massachusetts, we're doing an effort around enhanced education and access for these FDA-approved nicotine replacement products.
To any of our witnesses, do you have suggestions as to what the FDA should have done? We heard the acting commissioner acknowledge that in retrospect, they should have been more active on the regulatory side for their upstream. What should have been done to avoid where we're at the moment? For people that are obviously patients that are sick, for businesses that are now shuttering or employees that might lose their jobs, for folks that are addicted to be forced into a black market for it, there's no part of the solution that is good at the moment. So how do we make sure we avoid this in the next round of whatever that might be, Doctor?
Yes, as my colleagues have said, it's unfortunate that we don't exactly know what the substance or device is that's causing these vaping illnesses. So when you don't know, it's kind of hard to say what you could have done to prevent it. But at the same time, I think the fraudulent marketing, the fact that a lot of adults and youth think that these products are effective or don't know what's in the products or that they're effective for smoking cessation is a problem. So
Was it wise for the FDA to essentially allow for these products to hit the market without knowing the consequences of these products?
I think that we could have potentially had stronger regulations sooner.
Dr. Tilson?
I think these two issues, too, are related but somewhat conflated. So we have the problem with nicotine, which we know is in there, and then we have the problem with what is in these substances with the vaping illness. I think we've known forever but the nicotine is highly addictive. And I think the lessons learned in our combustible cigarette tobacco, we should think about and be sure we're proactively applying those same lessons learned and comprehensive approach when we're thinking about a product that has nicotine.
Dr. Norman?
About 6 years ago, when I was the chief medical officer at the University of Kansas Health System, I outlawed vaping on our healthcare campus because we had a no tobacco policy. I got a certain amount of pushback for that because of the ostensible benefit for tobacco cessation. Didn't believe it then, and I don't believe it now. I think looking in our rearview mirror, we would have benefited by having much tighter regulatory controls on the products that are the vaping devices and the vaping solutions. I think we deluded ourselves early on to think that this would maybe be a flash in the pan, a fad that would pass, but nicotine doesn't act that way. It's too addictive.
Thank you all. I appreciate your testimony, and I'll yield back the final 5 seconds.
Thank the gentleman. I would advise the panel that there are some other members who would like to ask questions. They're upstairs at this other hearing, and they can't get down. And so under the committee rules, members do have 10 additional business days to submit questions, and I suspect several members, including Dr. Ruiz, who's a medical doctor and cares a lot about these issues, they will want to ask you questions in writing, and if you don't mind, if you could please respond to those, because this is an important public health issue. And I so appreciate all of you coming today, your perspective from around the country, being on the ground and what we can do. It's really vital to our consideration. I hope you don't mind. I've decided to deputize all of you as our experts in assisting as we develop these policies. And with that, again, members will have 10 additional days to ask questions. And I want to thank everybody, and we probably will be having some more hearings, certainly more investigation. With that, the committee's adjourned.
Thank you, ma'am.